Good evening. It is September 7th, 2021. This is a work session of the Board of Education for Medina City Schools. I'd like to call the meeting to order. If we could please begin the meeting with the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Mr. Chambers, if you could take roll, please.
Mr. Harrison.
Here.
Ms. Pavlik.
Here.
Mr. Ross.
Here.
Ms. Parkhurst.
Here.
Mr. Skidmore.
Here.
Thank you.
And then as we continue on with our housekeeping items, we do have a nice group of people here tonight. We want to welcome you. We appreciate that you have taken your time out to come tonight and to be here at the board meeting. We do have different points throughout the meeting for public comment, and we can have a discussion about that as a board if we want to rearrange the agenda, which we'll approve here in a minute. But right now we have, if you go to our website for Medina Bees and you click under Board of Education, there's a program called Board Docs, and within that program, our agenda is in there. So if you'd like to follow along, I mean, we are here for a regular business meeting of the Board of Education tonight. There'll be a point for public comment, and there's certain rules that we follow with that, so we do request that everybody keep in order during the meeting and so forth. And then at different points in time, there'll be a point to address the board, which at that point you'll be invited to the lectern, either of the microphones. If you have wanted to address the board tonight, you needed to sign up at the front desk with Lisa Paloha, and we do have several that have registered that tonight. So we would hope that you would do that. And so at this point, we have the agenda. I don't know if the board has any thoughts about rearranging public comment, or if you'd prefer to leave it where it's at, which is toward the end of the agenda. You want to leave it there? I'm hearing. You feel the same way? Okay. Let's leave it where it's at this point. So at this point, we have the agenda before you with items that we'll be voting on later, but at this point, I would take a motion to approve the agenda.
Second.
Okay, Ron, you made a first, thank you. Have a second? Mr. Harrison, seconded, okay. Right? Couldn't hear you, thank you.
Yeah.
Thank you, Mr. Harrison. We had a second. If you could please, and any questions or comments from the board? If you could please go ahead.
Mr. Ross.
Aye.
Mr. Harrison.
Aye.
Ms. Pavlik.
Aye.
Ms. Parkhurst.
Aye.
Mr. Skidmore.
Aye.
Thank you.
Okay, and at this point, we're in item D1. Mr. Sable.
And the first item up for tonight, as we wrap up our strategic plan and get ready to enter our second strategic plan, which we're just finishing up this year, one of the major initiatives of that strategic plan academically was the implementation of 21st century learning and teaching. And part of that goal is the implementation of makerspaces in our schools across the district. 5 years ago, we didn't have a single makerspace in any of our buildings. To date, we have makerspaces in every single one of our school buildings, including our high school, which this year we're just getting ready to open up and start the makerspace program at the high school level. So it is my pleasure to invite some of our educators up to the microphones today to share a little bit about what's happening in our buildings with makerspaces and the great things with our students. And I think we have our high school principal, Elisa Tadona, who's coming down right now.
Hello. I don't know if
Hi,
it is...
Elisa. You
Yes.
are being invited up to the front.
Oh, wow. Good evening. So I appreciate the invitation this evening. So the high school, we are greatly looking forward to building on the success that has been seen at the other schools. I can say specifically for our building, our goal is to really go from being consumers of knowledge and information and to creators of knowledge and information. And one of the ways that we wish to do that is by really looking and being specific at what we bring into our makerspace. So far, our students have had a lot of fun exploring and discovering our laser engraver, our button maker, our circuit boards. One student also helped put together a computer. So we have already hit the ground running. But I'd say what I'm most excited for is to look at what students want, what their voice is, what their perspective is, because I think that's the goal of the makerspace, is to keep evolving it and seeing what it can grow into. And I truly do believe that that growth and that vision will come from our students. So as we continue to move forward with this, I hope that you guys come check it out when you're in the building and look for communication coming from us, showcasing some of the highlights that we will have as our students explore in there and discover all new things and how we're going to be creating knowledge and information moving forward. Any questions you guys have?
That's great information. We want to welcome you again to the high school. We
Thank you.
appreciate the work you're doing there, and thank you for all the great information we're hearing about the beginning of the year and the start of the new school year. Does any of the board have questions?
I just wanted to thank you for coming tonight. I know we were really excited to get all the makerspaces up and running. The high school, I think, was the last one. We were on a little bit of a delay because of last year, so it's exciting that that is up and running. I had the opportunity to be at the Medina Festival a couple weeks ago and see some of our makerspace students from the middle school do a presentation with the Spheros and do an art design and relate it into curriculum, and it was just so exciting to see them showing what they've learned. This is why we're here, is for curriculum and to get these activities going, and it's great that we're seeing our last strategic plan come to fruition. So thank you so much for presenting, and I look forward to seeing more about the high school makerspace.
Yes, I couldn't agree more, and we have a wonderful student body who's already been exploring it and a fantastic staff who's really leading that charge. It's certainly not just me. We have great teachers and great staff who are doing a lot of that work. So thank you. I'll send that on to them.
Thank you.
Thank you for joining us this evening, Elisa, and feel free to go ahead and grab dinner somewhere.
Thank you.
And for allowing me to throw you in the fire on the first night. What we typically do, the board knows, but so everybody else knows, usually at every board meeting we have some sort of academic presentation. We try and get administrators, teachers, students to come present. With COVID, it's limited our ability to be able to do that, and slowly we're trying to bring that back because we need to celebrate the great things that are happening in our school district. Thank you, Elisa. The next item I want to share with the board is to discuss COVID protocols as well as mask mandates. There's quite a bit of information I would like to share tonight along with Dr. Kowalik. Several things that I want to talk through in addition to mask mandates. First of all, I would like to thank everybody for coming this evening, as Mr. Skidmore did. I also want to let everybody know that we have received a lot of phone calls, many hundreds of emails as well. I typically pride myself on replying to every email that I have received, and I must admit that I have not done that in the past few weeks solely because of the volume that we've received. We have received emails from all sides and views on this issue and topic, and I think it's important that our parents and our community know that administratively, and I don't speak for the board, but I think the board would agree that we take that feedback that we receive very seriously, and we do have conversations about it. And one of the reasons why I thought it was important to bring that up tonight is because, especially the last couple of days, I received a lot of questions about how people's emails or the information that they received was going to be utilized by the board. And I want you to know that we do read all those. We do discuss them as a collective, and our community's feedback does play into the decisions that are made in regards to recommendations and trying to make the best decisions for our students and our staff. Through the past week or two, in addition to the emails and phone calls, also we've had the opportunity to sit down and talk with many of our parents and community members. Several of those individuals are here tonight. And actually, several of the things that I want to talk about tonight are related to many of those conversations that I've had with those individuals. One of the things that was made loud and clear to me in the conversations that I've had is the feeling of a lack of information regarding decisions that are being made, why they're being made, making sure that there is an openness with the decisions that are being made, whether they're decisions that we can all agree with or not, having straightforward reasons why those decisions are being made so that they can easily be understood. And definitely we have a responsibility to clearly communicate why we're making decisions that we're making, especially when they directly impact our students the way that they have over the course of not just the last 2 weeks of school, but the course of the past year and a half of the school year. It definitely hasn't been easy, dealing within the parameters that we've all been living with, not only outside of school, but within the school parameters where we're all longing so much for some normalcy for our students, for ourselves, and we know the importance of having that for the health and success of our students, while at the same time battling a pandemic where I'm not going to sit here and debate the science behind it, pro or against, but it's part of what has caused the controversy and the conversation and the distraction for what is or isn't going on with students. So our goal, and I said this at our last meeting, is to keep our students in school. Unfortunately, we were in a position last year where we started school virtually. We were later in a position due to a large amount of positive COVID cases as well as quarantines, where mid-year we had to put a school virtually in the middle of the year because we had such a large attendance rate that was not in the building. And that wasn't just a student attendance issue, that was a staffing issue as well. And our goal this year is to keep our students in school. Tonight, with the information that I intend to share with the board, and of course we'll answer the board's questions to the best of our abilities, but I do think it's important to point out that I'm not a doctor, I'm not a health expert, and I'm not here to debate masks. I'm not here to debate whether they work or whether they don't work. What I'm here to simply talk about is the protocols and regulations that we are asked to follow or required to follow as a public school district, what those are, why we're following them, how we're following them, and how it impacts our students in the classroom or remaining in the classroom. COVID protocols and mask mandates. Last year, this was a much simpler topic simply because mask mandates were made statewide. This year, this topic was made much more complex because of the change in legislation over the course of the last school year. Many of those mandates that were in place last year, and I know many of our board members will remember that there was even a color-coded system in place for a period of time, ranking the level of the advancement of COVID, where many of those decisions were being even made outside of the school district, and we were more of a position of implementation of those decisions or how they would be implemented within the school district. What has happened this year is legislation has changed the law in regards to who, how, and when those decisions are made. Instead of those decisions coming directly through the local health department, they have come more at a federal and state level. There has been less local control in terms of those decisions. Last year, and we continue to have regular meetings with our local health department, but those meetings are a little bit different, where last year we were able to talk about protocols and potential adjustments to protocols, and we're able to work with the health department in making adjustments. We have less flexibility in making those adjustments. And the reason why is because the adjustments now can't be made as easily at the local level, but must be made at the state or federal level. And that's where things come into place like COVID protocols. If you look at the state of Ohio's K through 12 prevention and guidelines for COVID that they released over this summer, they are all recommendations for schools. All the recommendations include very similar protocols that were in place in schools this last year, including masking, social distancing, hand washing. The difference is this year they're in there as recommendations. So instead of this information and decisions being made at the level of the health department, they've been put on local school boards as well as school district administration. In terms of COVID and checking for COVID, I think one of the biggest questions has come with contact tracing and how that works and why we're following it. Contact tracing was actually developed by the CDC, which is at the federal level. The contact tracing guidelines, and they are called guidelines, were adopted by the state health department. Those guidelines are recommended by the state health department as well as the Ohio Department of Education for school districts to follow. So what the state health department is saying and what the legislation is saying is that we don't have to follow them, but they recommend that we follow those protocols. We have tried to listen to the community the best we can to implement protocols to keep our students and our staff safe throughout the course of this school year. So we do have protocols implemented, and the board did approve a return to school plan this past summer, which had some similar protocols to what we had in place last year, but there weren't as many of those protocols. Now, those protocols that were presented to the board and the board approved weren't blindly selected. We did look at what we had in place last year. We also tried to use information from studies that were out there in regards to what was successful in preventing the potential spread of COVID and what wasn't, and sticking with those protocols. That is a big reason why we started this year without a mask mandate or without me recommending a mask mandate to our Board of Education, because we are trying to listen to our community, and we did see success at the end of last school year without the use of masks. As a matter of fact, I think we finished up approximately the last 3 weeks of school, which was probably the most normal 3 weeks of school we've had in a year and a half. And that was before the Delta variant hit and things started getting a little bit out of control.
Excuse me. Order, please. Go ahead, Mr. Sable.
That was before the Delta variant hit at the end of the summer, and the timing is very frustrating because it was heading right into the course of the school year. In terms of contact tracing, which are guidelines, the reason why we have to follow contact tracing is because contact tracing comes through as an order from the local health department. The health department issues orders for quarantine. In order to issue an order for quarantine, the health department needs to follow or selects to follow the procedures that were put into place by the CDC and the Ohio Department of Health, which
Okay, I'm sorry. One moment, please. One moment. There is a time for public comment, okay? We want to have an orderly meeting, okay? There's a time for public comment, and it's later in the meeting. Now, Mr. Sable's addressing the board. If you've signed up to speak, you'll have 3 minutes to speak and to say what you want to say at that point. But please do not interrupt the speaker, and we won't interrupt you all when you're speaking. So please allow us to conduct our meeting with order. We please request you do that, okay? I understand everybody's here and everybody has opinions on it. That's fine. You're going to have a time to share your opinions, but we'd like to be able to conduct the meeting, and so we'd like Mr. Sable to continue on with his statements, please. Otherwise, we'll be forced to take a break or to have something else, and I don't want to do that. I want you all to have plenty of time to speak when it's your turn to speak, okay? But we can't all yell over each other and so forth. Let's work together. This is, Medina works together. This is, we expect we all work together. Let's do this and have a good meeting. Go ahead, Mr. Sable, please.
So in terms of contact tracing, which again, the local health department does have the authority to order a quarantine, and in order to quarantine, they are using the contact tracing process that is implemented by the CDC as well as adopted by the Ohio State Health Department. We are required through Ohio Revised Code 3707.48, 3701.81, and 3707.16 to follow the health department's lead in the contact tracing process in order for them to implement orders for quarantine. And basically what these revised codes say is that we have to follow health department orders such as a quarantine. We are required by law to protect others from contagious disease spread if we are aware of it, and we must enforce quarantine issued by the health department. So one of the common questions I got, or I have received, is why does it seem like we are issuing quarantines? And I think that's a good question, and I understand why we're getting it. Because oftentimes it's our building principal that's giving a family a call to say that there has been a contact within a building and a child is being quarantined. We are the deliverer of that message. We are not the ones implementing the quarantine. The health department is actually the implementer of the quarantine. We do understand that that message with the health department has been unclear, and that is a conversation that we have had and are continuing to have with the health department, and it's been a concern not only with ourselves but with other districts as well. And I do anticipate that there will be some changes to those protocols so it is clear where the quarantine order is actually coming from and that it is not coming from the school district. In terms of quarantine numbers, which I'm going to ask Dr. Kwolek to go through here in a little bit, the biggest challenge that we face, our COVID positive numbers are definitely up this year. And we have already seen COVID positive numbers that have been way beyond daily rates that we have seen last year, even during some of our highest times of COVID. The amount of students that we have missing school due to quarantine has been a real struggle. It's not only a struggle for our parents, it's a struggle for our educators, and most of all, it's a struggle for our students. To see our students who have already missed so much school to not be in school is something that is not acceptable. For me, it's vitally important that we take every action we can to do what we can to keep our kids in our classrooms. And this is where I strongly believe this isn't about whether a mask works or not.
Okay, order, please.
It's pretty simple. By the current health department order and the contact tracing procedures that are in place, a student's chances of being quarantined and missing school are greatly reduced if they're wearing a mask.
All right, so I'm sorry, please refrain from outbursts. Please wait until it's your chance to speak, and then you're welcome to speak if you've signed up. We request order.
And it has nothing to do with getting COVID or not getting COVID. I'm not getting into that conversation at all. I'm simply talking about quarantines. And a quick example, just this past week, and we don't have a lot of masking data yet because the masks have been minimally implemented just midway through last week. But just to give you a quick example, we had a COVID case today where one student was COVID positive and only resulted in the COVID positive individual being quarantined, where a similar case last week resulted in 13 students being quarantined. Now, if you magnify that to 40 cases in a day, which we have seen, it's a much more drastic number. So what I'm talking about today with the Board of Education is keeping students in school. Dr. Qual?
No, this is his time. If you have questions, you can present them up here, but please do not interrupt. Please go ahead, Mr. Sable. This is not a question and answer time. You're out of order. You're out of order. You're out of order. Please proceed. Please proceed. There's a time, I'm sorry, some of you have never been to a meeting, and I apologize that you don't know this, but this is a work session of the Board of Education. There is a time, I've told you when you all got here, and some of you got here late, we use a program called Board Docs. Within that program is the agenda. The agenda has a time for public participation. This is not outbursts. This is not, let's come yell at the board and all that. It's a board meeting, and then we're going to take action items tonight. And if you're welcome to participate at the right time, but it's not raise your hand and ask questions. There's a time where you can come up and address the board from the microphone, and if you've signed up with Lisa, and if you didn't get a chance to do that, that's fine. But there's a time for that. But right now, Mr. Sable is addressing the Board of Education. He's giving us an update, okay? So the question and answers, if you have those, you can email us, you can call us later, you can do whatever you'd like. But please let us have order with this meeting, okay? Please proceed.
Dr. Pollack, if you could share the numbers at this time. And Mr. Alcol, if you could please project the COVID spreadsheet for the board.
And you'll probably have to blow it up a little bit. So what we wanted to share tonight with you is per building, the number of COVID cases, and then what % of the building's population that is, to put it into some perspective. So that's going to be the first chart you see here. And we're doing this based on a 2-week period. So school started on August 17th. So this data in this first box is from August 17th to August 30th. Then what we did with that, like I shared, is based on the enrollment of that building, then we give you a percentage by building based on the total population of that building. So the first box are COVID positive cases. Then if you go to the next box, these are the number of students that were quarantined based upon the Ohio Department of Health's guidelines. Based upon those positive cases. So Mr. O'Call, if you can scroll over. And then the % quarantined based upon those cases. So it gives the board a sense of how many students were quarantined based upon those school cases. And then again, based upon that enrollment number, what % of that population is. And then the next chart, we also have students that are quarantined, but not because of a school case, because of a home case. So if Mr. Ross and I live in the same household and Mr. Ross has COVID and I'm required to stay home, we would not count that as a school case because it was home-based. So that is a separate chart that we included. If we get a call and a student is quarantined at home, but due to contact in the home, we made that a separate case. And so then the last chart for you then gives the board a sense of total percentages of students that are out because they were positive or due to any sort of COVID instance. And so it gives you a sense of what percent of that building's population is out due to COVID. So for example, in the first 2-week period, 21.15% of Root was out due to COVID, 10.63% of Canavan, 8.14% of Garfield, and 7.51% of the high school. So we'll continue to do this every 2 weeks to give a sense of how many students are out due to COVID and then how many are out due to quarantines. And to go back to Mr. Sable's point, if you go back to the bottom, our concern, again, given the guidelines we've been provided by the Ohio Department of Health, the first 2-week period, we have 361 students that if they were wearing a mask, again, based on the guidelines we'd been given, would not have had to learn from home online if they were masked. And so I think that's Mr. Sable and all administration and staff's concern, is that these are students that are then required to learn online at home rather than in our school buildings. And so it's a concern we all share. I don't know if the board has any questions about that.
Thank you, Dr. Pollack.
Mr. Skidmore, I do have a question. Dr. Pollack, for these 361 who are out on quarantine, will you be tracking, can we track how many of those students actually would end up testing positive?
So we don't do that because the Ohio Department, it's the Ohio Department of Health's job.
I'm sorry, can you, I couldn't
hear me?
at the beginning. I'm sorry.
So it's the Ohio Department and the Medina County Health Department's job to do that. So they are doing that and do gather that data, and they do specifically look for school spread. That's one of the things they do, but it is not something the school is in a position to do.
But wouldn't be, if the Medina County Health Department is doing that, can we ask them to provide us with that documentation? Because I know all of the board members are interested in seeing that.
Yeah, absolutely, we can.
Yeah, we actually are having that conversation. I actually received information the end of last week where Warren County is looking at doing a pilot program and adjusting their quarantining procedures. And what those quarantining procedure pilot program would be is for all in-school quarantines. However, in order for an in-school quarantine to occur, the individual student or staff member would be required to wear a mask throughout the quarantine period and would be required to complete an FDA-approved COVID lab test. I think it's twice during the COVID period, and not show symptoms. Right now, it's looking like this pilot program might go in place by the State Health Department in Warren County. It might be available in the future to other counties. That remains to be seen. Today, I did have a superintendent's meeting with the health department as well with Medina superintendents, and this was a big part of the conversation that we had today, as well as what we can do as a county. Again, like I said, our goal is to have our students in school. We want to take the measures we can to keep them in school and keep them healthy. And we want to find the best ways to do that. And as a district, we don't have that data. The health department is working on that data, and they said they would provide us that data. So as soon as we have it, we do intend to provide that to the board, and we'll make that available. But you know, if I had to guess, and I'm just going to be honest, you know, I'm sure we have some students that are getting sick in quarantine. I'm sure we have a lot of students that aren't, and that's a concern, and that's why we're having the conversation.
And Val, I know in some of our preliminary discussions, it's really hard to pinpoint, according to the health department, if you do have a student that gets sick, that it was school or wasn't school, because some of the same students that hang out together or sit by each other at lunch also hang out outside of school. So I don't know that we'll ever get the definitive answer we're looking for, but we can absolutely ask for that information.
I would just add to that Krista, we did request that she attend tonight, Wasowski from the Health Department, and I think she was unavailable tonight. But the board would be, I know she's in close contact with the administration, but I think she's addressed the board previously around 2013 or 2014 on another matter when there was a health concern at that point, starting nationwide with a different event. But I know that it's not that she's not busy and working really hard. We recognize that. It's not that, but again, I think it would be helpful to hear directly from the health department on this matter. And I mean, there was some thought about whether there could be an all-county board meeting, maybe at the Career Center, as we've done in the past. Sometimes the ESC has hosted that, and maybe Krista could be present for that and could address. I would like to hear kind of a high-level approach of information she's getting about COVID and about the future prognosis as far as kind of what might happen in the future. She's obviously privy to probably different information than we all would get as being a public health department official. So, but again, I appreciate the work the district's doing and the work she's doing. Nobody has signed up to have this trouble, and nobody wants this trouble as far as COVID. Everybody wants everybody to be healthy, and we want to balance everything. And I think the administration has really done the best that it can, and I can't even imagine the amount of hours that you all have had. You, Aaron, especially Chris, too, with running. She was the principal last year at the high school and did a phenomenal job. And just what you've done with protocols and trying to do it safely and properly, and it's a thankless job. So we appreciate the work you've done, and it seems like sometimes we only hear from two ends of the spectrum. We never seem to hear from the middle, unfortunately. But from that standpoint, I think there's a lot of opinions that the board has that we'll probably get into tonight to some extent. But it sounds like you've got some recommendations for us. But before we get into that, you have the other matters to look at. So I'm sorry I interjected, but go ahead. Thank you.
And I just wanted to briefly share with the board the two board action items that we have for later in part of the work session. But I have two options to present tonight. The first option for a mask mandate is a recommendation to do more of a blanketed mask mandate. And this would be to be reevaluated on October 4th. This is similar to what we're seeing other districts in Medina County doing, which is a pre-kindergarten through 12th grade mask mandate within school buildings, so it doesn't include outside of recess, doesn't include lunchtime while students are at their tables. Athletics continue to follow OHSAA guidelines and is in place pending the board's decision at the future board meeting, and also pending the data which Dr. Kwolek shared tonight. So we would continue to accumulate this data and share it with the board at a later board meeting for another decision to see if numbers have gone down as to whether the mask mandate should stay into effect or whether it should be removed at that time. The second option, we worked with the data a little bit and looked at more of an individual basis in regards to the buildings. I do think it's important to point out that we're working with 2 weeks worth of data this year, so we don't have a lot of data that we're working with at this time. But what we would do under this situation is we would reevaluate the buildings on a 2-week basis and we would evaluate them individually based on absentee rates due to COVID. So those absentee rates would not include regular absences, whether they're doctor's appointments or a cold or whatever else it might be. It's only the absences directly related to COVID, which does include quarantines. That a 3% at the elementary buildings and an 8% at the middle schools and high school, and then a 10% for the district as a whole would implement a mask mandate for a 2-week period to be reevaluated at the end of that 2-week period by the 2 weeks worth of data. The buildings that we currently have under quarantine are under quarantine per this data. Those are the ones that I put into an emergency quarantine last Wednesday. So theoretically, if this is the option that the board approved, in another week and a half or so, we would be reevaluating these percentages over that 2-week period. The reason why we have a different percentage at the elementary versus the middle and high schools is because of the way the quarantines work. When we have a quarantine at an elementary building, it typically is within a single classroom, so we see more children out of one classroom because they don't change classes. Where at the middle school and high school level, it's more typically spread amongst different classes rather than just within one single class, so it's less impactful on a single class. The other piece at the elementary levels as well, which we have taken into account and I included in my communication to parents last week, is vaccination eligibility and having that option to even have the vaccination, which the elementary students at this time do not. I'm welcome to conversation with the board regarding these two options and the option that the board would like presented. We can also wait till later when it's time to present the action item if the board prefers.
My suggestion would be let's go ahead and deal with E, if you're onto that one. Yep. Let's talk about E, and then maybe we have a broad discussion briefly about F, and then if there's clearly a motion on 1 or 2, then maybe we proceed with that, unless you have a specific one you are primarily recommending or you want us to consider. And then we do that, and then we go through the whole, comments. Thank you.
For E, action items for this evening, these are regular business items. The first one, good news. It's recommended that the Board of Education approve to amend the service agreement between the Medina City School District and the Educational Service Center of Medina County to provide one-to-one aid services at Windfall School and special education aid services effective July 1st, 21 through the 30th of 22. And we are actually getting money back from this. These are services that we anticipated needing to have to provide through the Windfall School, where we no longer need to provide them for a student there. The second item is personnel. It is recommended that the Board of Education approve the following personnel recommendations pending completion of all required paperwork per the Department of Human Resources. One I do want to point out on here, last week we congratulated Mr. Burkhart on his resignation for purposes of retirement. He is retiring effective September 30th. I have made the decision not to post his position at this time, and there's really multiple reasons for that. First of all, mid-year really isn't the best time in education to fill a position. Normally our hiring season is in the spring to prepare for the next school year. The second reason is we have a number of administrators highly qualified within our district who I know are interested. And with all that's going on, it really is not an ideal time to potentially pull an administrator from a current position. And I do want to make sure they have a fair opportunity to interview and have a chance at that Director of Business Affairs position. So I am recommending a long-term substitute administrator, a retired administrator, Robert Whitaker, for that position. And that'll be effective September when Mr. Burkhart completes his contract through the end of the school year in June.
Okay, so we have action items E, 1, and 2, and if it would be the pleasure of the board to take those together, we can do that. So if we could entertain a motion for 1 and 2.
I'll make a motion to approve those action items.
Thank you, Mrs. Parkhurst. Do we have a second?
I'll second.
Thank you, Mr. Ross. Any questions or comments from the board on these 2 action items? Hearing none, and at this time, we open up for just these 2 action items. Later, there'll be public participation for regular matters, but just on these E, 1 and 2, the personnel, if there's any public comment on that, now is the time. Hearing none, if you could please call roll.
Ms. Parkhurst.
Aye.
Mr. Ross. Aye. Mr. Harrison.
Aye.
Ms. Pavlik.
Aye.
Mr. Skidmore.
Aye.
Thank you.
So I don't know if you just want us to have a discussion about it, or if you want to make a recommendation on F.
No, I think this is now, with the board, this is our work session. I think now is when we need to talk about, because I want to go back to the quarantines. And one of the things that Mr. Sable and I talked about on Friday was that the number of cases have increased, but we're also running the buildings all at 100%. Unlike last year at this time, we were in hybrid, right? We were in a hybrid schedule at the high school, and we also had students enrolled within the MODA program, which is the online program. Great. Okay. So I just wanted to clarify that to the community too, that our buildings are at 100%. So it shouldn't be too much of a surprise that we do have higher numbers, positive cases. Going back to the guidelines, the quarantine guidelines, and this is the 3rd meeting that I want to bring up again and ask, especially since, Aaron, you stated that it's now up to the local school boards and administration recommending procedures, contact tracing through the local health department. Nowhere in this guidelines for quarantine does it address a student who has recently had COVID and then ends up getting exposed again. So really, there should be a 3rd branch on this because, for example, say Aaron's daughter gets tests positive, out of school for 10 days or 2 weeks, comes back to school, 2 weeks go by, and she unfortunately sits at a table where another student tests positive. Well, she's just 2 weeks out of her quarantine. Her body's probably teeming with her antibody protection. But according to this chart here, if she wasn't wearing a mask, she's got to go out of school again for 2 weeks. So,
Vale, I do just want to clarify, we do not quarantine students who have had COVID within the last 90 days as a school district, because and neither does it. So whenever we have a question, we would call the health department, and that would be one where we absolutely would call for clarification. And we did have that come up just recently. So Aaron and I both did bring that up to Krista, and I'm pretty certain, and I can't speak for her, that she's contacted the Ohio Department of Health because this is their flow chart, but I just didn't want anyone to worry. If your child has had COVID and you have proof of a positive test, they will not be quarantined for 90 days.
Chris, was that 60 or 90 days that you stated?
It's 90. Remember last time, I think
90.
I had questioned it, and Val was, it's
Thank
90
you.
days.
okay. Thank you for clarifying that. Is there any way or anywhere on our website, though, that we can have that in writing? That's the procedure we follow?
Sure, I can link, again, we're not the ones doing the quarantining, but I can link them to the website where it indicates if you've had COVID in the last 90 days, you aren't quarantined.
Okay.
Yeah.
All right. Thank you. Also, too, another comment, and I was definitely disappointed when I opened the Gazette on Monday morning and saw the headlines there. And one of the things that I want to make sure that, again, we were talking about, and is even mentioned before this meeting, that there are some school districts that have not even started school yet. So the fact that we get thrown under the bus like that in the state's top 10 for new cases is kind of misleading. So again, especially when at the end of the story it's stated that that Medina County cases have also resulted in hospitalizations with a known admission date and another 76 hospitalizations where no date is confirmed. I routinely download that CSV file from the state to take a look at the data because I'm trying to, again, we have to make these decisions based on data. And it is very disconcerting to see the discrepancies in the state's data. And that's why I have been asking, and I'm very glad that this spreadsheet that was shown up earlier, because we need to make decisions based on the accurate data, and we need to be able to reconcile that. So thank you, Chris. I really appreciate the hard work, because I know this is not easy. And again, another thing that we talked about is our educators. You guys aren't the data analysts, but you've been forced into these positions, and it is taking away from our focus on educating our children. And that is very frustrating, I know, for everybody, community, parents, students, us, administration. So thank you. I appreciate the information you showed us tonight.
Thank you, Mrs. Pavlik. Any other general broad discussions about option 1 or 2 at this point? Aaron? Harrison? Mr. Harrison?
Yeah, I just have a couple takeaways, I think, from both the comments that have been shared tonight, and then also, as I think Mr. Skidmore and Mr. Sable, and I think everybody's mentioned, we've received plenty of feedback from people on both sides of the issue. And I mean, it's something that, I know people on both sides of the issue and really take to heart people who see it differently than I do, in addition to people who see it similarly to the way that I do. The one common theme, and it was obvious in Mr. Sable's comments, and I echo it and completely agree with the sentiment of it, which is universal in all this, is we want to keep as many healthy kids in school as possible. I think where my opinions start to diverge is how we best accomplish that. Because right now, when I look at the flow chart that Mrs. Pavlik was referencing, and from the moment I looked at it before we even had kids back in school, it appeared to me to be oriented around changing behaviors rather than outcomes as they relate to COVID. And when I look at our numbers and I see a certain percentage of COVID positive cases, and for each of the, resulting in absences, and then the Gazette article, the Gazette's had trouble since the beginning of all this separating COVID absences from quarantine absences. I don't want our policy making to be kind of a mismatch of absences as a result of COVID policies and absences as a result of COVID cases. Because in my mind, at some level, whether there are policies or the health department's policies, we can control those policies. And I think we need to be doing a better job of that. My question, there is a question. My question relates more to the pilot program you mentioned. We talked about it a little bit last week. What's the timeline on that from a Warren County standpoint, and what's the timeline on rolling out something that Medina County could take advantage of? Because as it relates to the policy proposals that are in front of us tonight, that's my single biggest factor, are these things going to be accompanied by a more workable quarantine solution, or are we still going to go back into the same quarantine policies, which I think are unworkable?
Yeah, and I don't have a specific answer for you. I mean, the Warren County pilot program is something that just came up late last week. I'm not even certain that it's been approved yet by the Ohio Department of Health. It did look late last week like it was going to head that direction. It is a conversation that we are having within the county and did have today with the Medina Health Department. It is something that superintendents across the county are talking about and are concerned about and are going to continue to talk about. And like I said, we want a system that works and keeps healthy students in school, whatever that system is.
Well, and I think the issue that comes from this is we've shifted from last year at this time, we were wearing masks to avoid COVID, and now we're policy making based on wearing a mask to avoid quarantine. And I think the quarantine policy can be changed. The only other question that I had related to your comments, and again, I want to be clear that I do appreciate the work that you're doing and everybody in the administration's doing on this, even if I have disagreements in terms of the outcomes. And I think that is something that's easy to lose sight of in, large audiences like this. But based on the hand we've been dealt, I've said this privately, I'll say it publicly, I don't know how you'd handle it differently right now. I think that's worth mentioning. But are we regularly, I think it wasn't clear to me from your comments, are we regularly receiving quarantine orders from the local health department, meaning that as I look at the second column on the sheet, would we have received whatever, in the neighborhood of 500 orders from the health department for this year, or is that something that's going to start from this point forward?
So, do you want me to? So it's a constant back and forth communication. So the health department is letting us know of a positive case, or sometimes we're letting them know because a parent's calling us and saying their child tested positive, they're not going to be in school. And then the health department is vetting that positive case. And so then the health department is calling us saying who was within 6 feet or whatever parameter they're calling us with, and then they're asking us to confirm who that might be, and then they're creating that list and clarifying who that is. So that's how the process works. So to give you that answer, essentially it's they are creating that quarantine list that they then keep on file. To expedite it for our parents, though, we're making the calls. Otherwise, I don't know how long it could take for them to be contacted. So that's in practice how it works, to give you that answer. So we're assisting in the process to expedite it for everyone. So we don't get 500 pieces of paper. It's more of a electronic system that we go back and forth with. Because sometimes we might be the first to be notified if a parent calls us because they're calling their child off sick and they just got the results. Sometimes, interestingly enough, students will email because they got their positive results before their parents can even call, but we vet all those. I was telling Val a story. Sometimes we'll get a call that a student has a positive test, but we follow up, and sometimes it's strep and not COVID. Again, we're not counting anything until we have a positive test result. So did that answer your question?
It did, yeah.
Okay.
I didn't, my understanding was that wasn't how the process was going, but it might be heading in that direction. So will they be taking a more active role going forward, or is it going to continue just from a practical standpoint, it'll continue how it's been going?
So I think the question, in terms of active, I guess they're active, but we would like to see them then following that up with formal letters. I think that's what Aaron has talked to them about. And so that way parents can feel like they're more formally involved. Parents are always, we always offer if they want another call from the health department or they want to call the health department, they're always available. Colin Johnson is the person we work with at the health department, so he's always available to follow up anyone who has questions. But what we're asking for is they get a formal letter.
Okay. And yeah, that's again where I echo Mr. Skidmore's comments from earlier, that it would be helpful to have an audience with the health department to ask some of these questions directly, because I feel bad putting you guys on the spot to answer some of these questions on their behalf too, but one way or another, I think we need to get the answers. So thank you.
Mr. Harrison, could I ask for some clarification? You mentioned last year our policy was to prevent COVID cases. this year is prevent quarantines. Did I understand, did I hear that correctly?
I said it's kind of what it seems like, yeah. Yep.
Because I think, I disagree in that we were trying to prevent cases and quarantines last year. Last year, we had protocols where we needed to keep students 6 feet apart, which is why we were not at full capacity at the high school. There were many more protocols in place in terms of dividers and one-way hallways and a lot more, no congregating, a lot more protocols in place. And as the state saw that they could reduce those quarantines to 3 feet, they did, and we did as well. So I think that we're just, as the science and everything evolves, the state is giving us
Order, please. Order. Go ahead. Sorry.
those protocols, and we're trying to follow them, again, just to keep our kids in school. And I think that's what everyone wants, is we want to keep our kids in school. It was not good last year when we were online, and everyone knows that. And I think it's important. We've, as Mr. Sable mentioned, we tried to start with a more normal school year. Everyone had great hopes. I never in the world thought that I would be sitting here 18 months later talking about masks again. But lo and behold, here we are. And our schools are reflecting our community. Our community cases are going up, and as such, our school cases are going up. And we're at a point where we have to do something in order to keep our kids in school, physically in person in school.
Well, I think
Order,
the
please.
only issue with that is that I guess I have with it is it seems like we're starting with these restrictions and policies in schools in a population that has generally had the best outcomes when they have gotten sick, as opposed to starting with the more vulnerable populations where the outcomes have been worse. And to me, it suggests that we're doing that because we can, and that's something that I'm not necessarily supportive of, is the eagerness to restrict our kids.
Thank you, Mr. Harrison. Let's come back. Mr. Ross, do you have any, in other words, if I look at this correctly tonight, we have basically 3 options. One is potentially to do nothing, which I'm not sure that that's what's being recommended. I think you're recommending that we do something. Order, please. The other options are option 1 and 2 that are presented tonight for us. I mean, do you have some comments on those, Mr. Ross?
I do. I do. What I wanted to say was, well, first I want to thank Mr. Sable and Dr. Qualley for all their work. It's a tough period. I've been on the board 6 years now, almost 6 years, and this is the most I've seen at a school board meeting. So there's a lot of passion in this room, whatever side you're on. So I appreciate y'all coming. But I have concerns, though, and they're not going to please everybody. Number one is we tried, when we started the school year, we tried an optional plan. And one of the reasons for doing that was we wanted to satisfy the people that don't want to wear a mask, and they didn't have to if they didn't want to. And then the people that wanted to wear a mask, they could if they wanted to. So we tried that, and it didn't work. We're here today. The numbers are surging. The data is...
Order, please.
The data is out there. The data is not debatable, and I think I read in the Gazette on I think it was last week where we were ranked 10th in the state of Ohio for the number of kids that are out of school, and that
Sorry,
concerns
please,
me.
Mr. Ross, 1 second, please.
That concerns
Please give
me.
Mr. Ross the respect to make his statements, please. This is the Board of Education meeting. There'll be a time for public comment. We please request that you don't interrupt Mr. Ross. Please proceed, Mr. Ross.
Thank you. That concerns me. And so my thinking is we got to pivot. We got to go to Plan B. And if we don't do something, we're going to end up preparing the virtual plan and going back to that. And that's not the goal. The goal is to keep to keep our students. The goal is to keep the staff safe students safe, and to keep the kids in school. That's the goal. And so if we don't change our behavior from the results that we got from the first day of school till now, the numbers aren't going to, I don't see the numbers changing. The numbers are surging. And we have to look at that and be realistic about it. And so that's my concern. And I am going to support a mask mandate. Thank you.
Okay. Mrs. Parkhurst, did you have anything else you wanted to?
The only thing I wanted to ask was for clarification. Mr. Sable mentioned that some ORC, Ohio Revised Code numbers, that we are required to follow any quarantines put out by the Department of Health. Did I understand that correctly, Mr. Sable? I'm sorry, I can't hear you.
Yes, we are required by law to follow the quarantine mandates of the local health department.
Thank you. And then therefore, we would be liable if we were not to follow that law and someone would become ill?
Yes, that's correct.
Thank you.
And it's, Mr. Sable, it's my understanding we have a legal opinion too from our counsel that explains that process and that we are following that process, is my understanding.
We do.
Thank you. So the board takes this seriously to make sure that we're, because as we've said at the outset, there's a variety of opinions on this. For as many people that are in the building tonight that don't like masks, we've had just as many emails or more, and some of them 5 times an hour, literally, with charts and graphs all weekend long from individuals as well. So there are a multitude of opinions. I'm sorry, your time will come in a moment to speak. There are a multitude of opinions on the matter. So this has been an overarching discussion. So I guess the question is, do you want to make a recommendation to us, or would you like the board to formulate a motion with one of these two options, whichever way you want to go with it, Mr. Sable? I mean, it's my understanding too that the asterisk applies to either option 1 or 2.
Yep. Well, why don't I share my recommendation, and then the board can formulate a motion based off of my recommendation. My recommendation is for the board to adopt option 1, to implement a mask mandate for PK through 12 through October 4th.
Order, please.
2021. I do not want to throw out option 2. I think option 2 is something that we need to reevaluate at a later board meeting after we have more district data and after we've gotten into a situation where we have less students in quarantine and more students in school.
Should I make a motion to approve that? Are we making an action item or just a recommendation?
Go ahead.
Okay, I'm going to make a motion to approve that recommendation.
I'm sorry, order, please.
I'm going to make a motion to approve the superintendent's recommendation as stated.
Okay, so we have a motion. One moment. I'm sorry. Relax. One motion for option 1. I'll make a motion for option 2. Do we have a second to either of those motions?
I'll second option 1.
We have a second to option 1. Okay. So we have a first and a second to option 1. Okay. Now we will go to questions or comments from the board on option 1. And would anybody like to open that up? And we will open it up to the public before we vote on option 1. Okay. So questions or comments from the board for option 1.
But, Mr. Skidmore, we do have a regular meeting scheduled for September 20th. So this would actually go to our next work session, this recommendation? Is that in an effort to have a meeting where we don't talk about masks? And that's, fair answer is yes.
The real answer is a combination of yes, but also to allow for more time for more data accumulation. Because like I said, a concern all along has been it's been 2 weeks of school.
And what do we expect to know by way of the revised quarantine policies by October 4th? Based on, I know you had a meeting today, is there any reason to believe that anything like that would be in place by October 4th that would affect Medina County schools?
I mean, I can't give you an answer on that. I know you want an answer on that question, but you want an answer that I can't give you because I can't control what's happening at the state level.
My thing is that to reevaluate at the next work session, 4 weeks is definitely too long. It needs to be talked about every 2 weeks. We have the data now. We've got the system in place. We can more easily monitor those numbers. So 4 weeks is way too long on that. Two, going back to, again, the local health department issuing the guidelines. You mentioned today about talking in the superintendent's meeting regarding the proposal for Warren County. I know that when we talked on Friday, when you were in the meeting with the superintendents, did you tell them that you knew that your board would be in complete support by forging ahead? I'm not crazy about waiting for Warren County to see how their pilot program. Why can't we take the initiative for Medina County instead of always waiting to see what other counties do? Let us be the leader. With the whole portrait of a graduate, we always talked about critical thinking, thinking outside the box. Again, being the leader instead of the follower.
We actually did have that conversation about working together, school districts in the county, and making our own proposal, and hopefully having the backing of our local health department in doing that. The other option that was discussed and that I asked about is if our Board of Education elected to implement the Warren County pilot program on their own without the endorsement of the health department. And I am actually waiting to hear back from the county prosecutor's office on an answer to that.
When you say health department, do you mean our local health department or the state health department?
I mean the state health department.
Okay.
My comment on option one is that I'm not in favor of it right now. I think, order, I'm sorry. I think that it's arguable that I'm not indicating that there aren't some benefits from masks, but I guess what we have in place right now, or what's been in place, and again, as I said earlier, I was more inclined for option two if we had to do something, which is, in my mind, what Mr. Sable has done now through his order, that he put on, I think it was last week sometime. But we had a voluntary system in place and where people could make a decision, or families made a decision about whether their child should wear a mask or not. And I think those that are especially susceptible, those that are concerned, should feel free to wear a mask. And I feel that that's acceptable, that they do that. And I feel that that's... And I also am not certain that, given the timing of the year, when we started, I'm not certain that we have data that tells us that the spread was clearly community spread in the school. It's not real clear from that. And it's also not clear that from the quarantine data, and I agree with what Mr. Harrison said earlier, that really we're doing these out of result of quarantine. Now, I think a reasonable parent that is anti-mask wearing might tell their son or daughter to wear a mask because of the quarantine rules that we don't make. And I know everybody feels differently about that we don't have to follow those. But again, I think that we do, based on our letter that we have from our council and based on the practice of what all the districts are doing in the county as well as other areas. So I don't care for masks. I see that there is some level of benefit that they could provide. However, I do feel that there are certain things that they affect. They can affect your ability to communicate. They can affect special needs. They can affect all sorts of things with that as well. And I'm sure we'll hear other things that you all communicate to us tonight as well. But so right now on option one, I'm a no. That doesn't mean that I don't respect the work that the district's doing. I would prefer option two if I had a choice. So that's where I'm at.
Thank you, Mr. Skidmore. The reason I agree with option one is similar to what you said, where we don't have enough data, and I think it's important to get enough data. A month out gives us that. Option two can be confusing, just with those numbers, and how do we even really come up with those numbers? So I just think it's important to have much more data, and that is why I went with option one.
Mr. Ross, do you have anything else on that? I know you made the motion.
No, I agree with option one because it's, we don't have to worry about all the buildings, it's just the entire district. I think that's a lot simpler. And then we can reevaluate it, just go meeting by meeting, and reevaluate the data as we can set a date and then just look at what happened in the past month. And I think that's a lot easier, and it makes it easier for the parents to follow in the community. So,
Okay. Okay. Any other comments from the administration on option one? Any other comments from the board members on option one at this point?
Mr. Skidmore, I guess I go back to the date on there. I have a lot of confidence in our building administrators, and that includes Mr. Sable. I would, if it's an option that's available to us, to change the date from the October 4th work session to the next regular meeting, which would be September 20th. I would be inclined to go with Mr. Sable's recommendation if it were a shorter period of time, because I think there's just a lot of things that's unfair for us to sit here and hold his feet to the fire about answers that he just doesn't have available to him right now. So if, in the interest of having clarity and also showing our support for the administration, if it's possible for us to amend option one with a revisit date of our September 20th meeting, I would be in support of that.
Mr. Skidmore, as far as option one goes, I'm a no on that. One of the things that I struggle with, particularly, for example, and I've used this example in a recent meeting, at the high school, I know that we have 8 students eating lunch at a table and for 20 minutes, and a mask is off during that time, and one of those students tests positive, and that table gets quarantined. What is beyond frustrating is that those same 8 students could go to an Indians game, they could go to a Browns game, they could go sit at JoJo's and for 2 hours and have pizza and Pepsi and watch a ball game there. One of them tests positive. There is no quarantine there. And why is it that our students are the ones who are trying to be controlled on this? Because the Indians, if they're not playing ball, people are not spending money, taxes are not being collected, the state's losing out. Okay, so it's okay for the Indians to play, it's okay for the NFL to play, it's okay for all the restaurants to be open, all generating income so that all those tax dollars can go into the coffers. But the one thing that the state can put their thumb on is our kids. And this is what I struggle with this whole thing. And
Okay.
Mrs. Pavlik,
and that is why,
technically,
and that is why,
Order, please.
and that is why, going back to that pilot program in with the Warren County, that I want to see Medina being a leader on that one.
Okay.
Mrs. Pavlik, I think we would all like us to see ourselves as a pilot program. Unfortunately, we have to get the state health department sign off on that, as well as the governor. The governor is the one that signed off on the Warren County program. Additionally, technically, if those students were at an Indians game and they know they're in direct contact with someone, they should quarantine. They should reach out to them and they should quarantine because they had a direct exposure. That's just how it works. That's the personal choice that everyone is asking for.
Okay, Mr. Harrison, I would say we just proceed with it the way it is. And I would say we open it up now to the public. Anybody from the public that would like to address on option 1, you've got 3 minutes to comment on our vote on option 1 that we will do at the conclusion of public comments. I mean, that's for our regular stuff.
Mr. Skidmore?
If you are here to primarily talk about masks and you want to address during this, you're also able to address during the public comments, but if you want to do it during this 3 minutes, that's up to you, but it's, right now, we're talking about option 1, which is what we're going to vote on. It's had a motion, a second, and we will be voting on that as soon as we're done. So if somebody has a public comment, there's a lectern here, and the lectern will recognize you. We do request that you follow some rules, and let me read the rules real quick during public comment. Community wishing to address the board are asked to abide by the following. Attendees, and again, in this case, you don't have to register because it's about an action item. Please state your name, address, and affiliation. Please keep comments to a maximum of 3 minutes. No participant may speak more than once on the same topic unless all others who wish to speak on that topic have been heard. All statements shall be directed to the presiding officer. No person may address or question the board members individually. And again, we request that you keep a decorum with this and that we keep it at a level here if we could. So whoever would like to speak first, there's a mic on each side.
Mr. Skidmore, while people are coming up, I just want to clarify, sorry I didn't catch in fast enough, but just so everyone knows, at the high school, and Mrs. Pavlik, I'm sorry if I haven't clarified this for you, a whole table is never going to be quarantined at lunch. It's just the people sitting across from and next to. It's not a whole table. So if anyone has questions about that, they can reach out to me, but it's not a whole table at lunch. So
Thank you,
just for
Dr. Pauly.
clarification.
Okay, our first speaker here on the topic of option 1 on the masks. Please state your name and address.
My name's Andy Toth. I have 3 children in Medina School District. I'm at 3912 Crimson Harvest Lane. I'm going to speak a few facts that Dr. Rashida Gari recently stated on a September 3rd school board meeting in Pennsbury, North Carolina. She's not only a physician for 21 years, she's double board certified with firsthand experience with the management of COVID-19. You guys are forcing our children to wear masks every day with little leniency in high school. We'll get to that in a second, as if they're super spreaders, which they're not. You base this off science, yet the CDC and the Board of Health just recommend these things. They actually acknowledge it's not based off of science. As our elected officials, you are here to offer safety and education only, not anything else. You all lack things like evidence, science, common sense, and human decency. Masks have never contained any viruses spread by aerosol particles. They're too small to be captured by any type of mask, including the N95. This was most recently proven in 3 different studies by your heroes at the NIH. COVID poses almost no risk to our children. Their survival rate is 99.99%. You know that. But here's the big one. There has been 0 cases of student-to-teacher transmission. I will repeat that. 0 student-to-teacher transmission in the world. You're not getting sick. They're not getting sick. What's the problem? That leaves it with political. You have kept our children out of school last year and this year to false positive PCR tests. Did you know the creator, Dr. Carrie Mullis, stated it should never even be used to diagnose any infection? So don't talk about protecting our children. That's a lie. You're protecting your handout and your far left agendas. Do you know what it's called when you force a medical device that you explain to us as a mask on our child's face for fear of a virus that causes them or you no harm? It's called child abuse. Influenza killed 480 children in the 2018 flu season. That's more than COVID killed in the last 18 months. Did you recommend they wear masks then? No, you didn't. Anyways, as far as to the parents here, anybody remember when our kid has a headache and we have to take Tylenol to school, right? We have to sign their authorization form We have to bring an unopened bottle of Tylenol because they don't have the legal authority to give that to our children. This is much worse. They do not have the ability to do that. They beg us for that authorization. Remember, parents, organized lies are more powerful than unorganized truth. We need to get together right now and defeat these people. I'm almost done. I currently have an 11-year-old daughter at Northrop Elementary that has not been allowed to go back to school since the beginning of September. I will not put her in a mask. Several very important staff members have actually been supportive and said they disagree with this mandate, but unfortunately their hands are tied. I have asked you over and over again to just give me option B of her being able to do online schooling. You guys have not given me that option.
Okay, thank you for your comments. Next, go ahead.
Both of my daughters in 10th and 11th.
Sorry, your time's up. Next, go ahead. Well, you're welcome to speak. You can go outside and speak to whoever you want. Next, go ahead. Let's take a recess. The board will take a recess.
There is an active lawsuit going on right now in Wakefield County that mentions federal COVID funding. That mentions federal COVID funding was contingent upon mass mandating all students. The superintendent and the board of members are being sued even on personal levels. Did Medina take the same funding? If so, why has this not been brought up with board meetings and previous discussions with parents? Let's get through fables to sables. Get on with it.
I would like to remind everyone that this is a board meeting. This is a meeting of the board for business purposes. If you do not follow the board guidelines that were stated as forth by Mr. Skidmore at the beginning of the meeting, you will be asked to leave. Please comply with the guidelines and policies that we stated at the beginning of the meeting.
Wait. Excuse me, Aaron. Aaron.
The-
Hey, listen, if everybody wants to be heard, sit down for 15 minutes.
You can speak, just let's wait until our president gets back. We want to hear everybody. I just want to wait till the president gets back. Hang on.
Okay, it's 7:30, we're back on the record. Do we have our next speaker? Right here? I'm sorry, it's over here. Go ahead, sir.
Is my mic on now? Okay. Whew, thank you.
Good evening. My name is Sean Nelson. I reside in Montville Township, and I would like to give you all my opinion on the mask issue. I'm the proud sole custodian and residential parent of a Medina High School senior. I own 2 businesses here, one of which is based in Medina County. I'm an 8-year honorable discharge veteran, United States Army, who held a security clearance. My job in the military was psychological operations, part of Special Operations Command. My training was done at John F. Kennedy Special Warfare Center in Fort Bragg, North Carolina. Psychological operations convey selected information to target audiences. To simplify, we made propaganda. Propaganda could include emails, letters, and pamphlets. Propaganda is purposely designed for our target audience. That may include kids and parents in order to influence their emotions, motives, objective reasoning to ultimately change the behavior of society, foreign governments, organizations, schools, and even individuals. Our motto is persuade, change, and influence. Is this school board's motto as well? Psychological operations also design and disseminate propaganda in order for us to gain control over certain situations in a group of people for our agenda. Those emails have the same amazing psychological effects as watching CNN's 24-hour COVID. Sorry, I'm shaking. Those emails have the same psychological effects as watching CNN's 24-hour COVID death toll counter. Mr. Sable's propaganda emails instills fear within the target audience in the hopes they wear masks and to get vaccinated. For those that you aren't aware or are following me, you and I are his target audience. Everything the school board and media disseminates to us is propaganda for their agenda. This board stated last month that the majority of high school kids are wearing masks. This is blatant lie told by this board to make us feel guilty that our children are not wearing masks, and it makes us feel bad as parents. That's basic propaganda. The school board actions has psychologically caused more division and hatred within our students' population and their parents. You are school board members, nothing more, nothing less. You all need to stay within your area of expertise on this board and stop trying to persuade, change, and influence our children for your agenda. It is not your job. Just focus on budgets and teacher contracts. I will be damned if you have any psychological influence on these children anymore. I took an oath to defend this country against foreign and domestic terrorists. Even as simple board members, you are all dangerously falling into those categories.
Thank you, sir. Sir, thank you for your service. Thank you for your comments. Next.
Okay. Hi, my name is Jill Michalski, 6101 Triple Crown Drive. I just want to state, I think either the board isn't mistaken. I have talked to a few people about the whole rule about quarantining and whether it's the school's responsibility or the Ohio Department of Health. And if anybody in the room has followed HB 248 testimony, a Franklin County Health Commissioner testified in front of the Ohio House Health Committee that it's not up to their department to quarantine students or employees, it's up to the schools. They were clear about that. Representative Young asked that question and he reiterated that it's up to the schools. I also found some verbiage online talking about delegating authority to the Ohio Department of Health regarding health orders. And it says to justify these flurry of orders, the governor and state health departments rely on revised code 3701.13. The Department of Health shall have ultimate authority in matters of quarantine and isolation. However, this violates the Ohio Constitution, which vets the General Assembly alone with emergency powers according to Section 42, Article 3 or Article 2. I'm not going to read the rest, but I just think you should check your facts and check your legal counsel because everybody that I've talked to says it's up to the schools and the schools alone. Thank you.
Thank you. Over here.
Hi. My name's Nicole Macher. I guess I have some questions first about options 1 and 2. As I believe Ms. Parkhurst had mentioned, there were other variables, not just masks, that you guys did last year, right? You had kids 6 feet apart. They weren't sharing school supplies. I think I'm just confused as to why that's instantly the variable that you guys are jumping to, is that it has to be the masks that saved everyone last year. And it wasn't the other things, because kids are really germy, and if they're touching and sharing art supplies and things like that, I mean, me personally, that's the first thing that I jump to. But something that's been popping out in my mind this week is Romans 12:21, be not overcome of evil, but overcome evil with good. And the only way I know to do that is to pray. So if anyone else would like to pray with me right now, because I have about 2 minutes left, right? So, God, we need you in this moment. We need you to give boldness. There needs to be boldness from these leaders of this school to do the right thing for these kids. I'm sorry that it took this long for us parents to get involved like this. I'm sorry that it took this long for us to realize the type of leaders we had over this school and this district. I'm just begging right now that they do the right thing for all these kids. That's all we can ask. So please come into this moment. If any of them up on that board don't know you, I pray that they do. I pray that they learn to know you, because that's the only thing that's going to change all of this. You are so good, and what we need right now is good. So please help them to make the right decision. Please protect these children, and above all else, let your will be done, no matter what the outcome. We love you, Lord. Amen.
Amen.
Okay, thank you, Nicole. Next.
My name is Betsy Jenny, and I live on Dogwood Lane. On August 31st, our superintendent sent out an email about remasking all of our school staff AI route PK through 5, regardless of vaccination or already having had COVID. You stated that your goal was to keep our kids in school, and yet you continue to track and quarantine healthy children and count those healthy students at home as cases. This email by our superintendent stated that this mandate/decision was a collaboration with this board and the health department. I would like to know when and if this board actually met to discuss this mandate. It should be public knowledge, and there should be a record of such a meeting. So, was this our superintendent making these decisions without input and approval by our school board? Our superintendent doesn't even live in our school district, and his kids don't attend our schools and are not affected by his mandates. This board is here to listen to what our community wants for our children. Why do you constantly bring up other districts, what other districts are doing? You are here for our community and what we want for our district only. Many parents over the last few months have researched the facts and science for you about the harmful use of wearing masks, both physically and mentally. And we have handed you the research to back it up. These mandates are not laws, and the health department does not make laws. The choice to wear masks is still up to parents, their students as well, and our school staff members. Never in the history of this country have healthy people been tracked and quarantined. These mandates are unlawful.
Yes.
Our property taxes pay for our schools to be open. They pay for the teachers, the staff, the administrators, the superintendent's salary. We elected this board to listen to what we want for our schools and our children. Has this board given our superintendent free rein to make decisions on his own? Why, when about 98% of our students are healthy and COVID-free, and 99.9%, if infected, will be fine, are you making such decisions that negatively affect their health and mental well-being, as well as our staff? This is the United States of America, and we have a Constitution to protect us from such socialism and fear-laden mandates. Stand up, parents. Woo! Stand up for your children and for your parental rights.
Okay, thank you. Over here. Next. Go ahead. Please state your name and address, please.
My name is Holly Boyd, and I live on Craggy Creek Drive in Chippewa Lake. We moved back here after 20 years, and I am in shock what's going on in Medina County. I don't even have a kid here, but I'm mad enough. I'm going to go to every school board meeting. Those people are voted in by you. So if you don't like what they're going to vote on 1 or 2, you need to vote them out. They work for you, all right? The parents are the ones who decide. You don't decide, the parents decide. So you need to take a little pulse of what's going on here. Would you muzzle your dog all day long? Wait, let it off to eat and then put the muzzle back on all day? Would you? Would you muzzle your dog all day? Your little kindergartner puppy all day? Why not? Because it's sick and there's something wrong with that. Yes, it's real. COVID is real. I know people have had it. My husband had it. 99% people live through it, though. And you know, I work a lot with the homeless in Wheeling. Not one of them got COVID. They didn't distance, they didn't have masks, they didn't even clean. So, I mean, something's going on here. It's okay to go to a restaurant and walk in with a mask, but when you sit down and take the mask off. That science is ridiculous, and I'm talking, you need to listen. We listen to you, okay? The CDC is nothing more than like a Walmart. It's a private company. It is not a government entity. It is like Walmart saying, everyone else has bad lettuce. You can't buy their lettuce. You have to buy my lettuce, and shut everyone else down. Do you know the CDC owns 20 patents on vaccines? They have a thing to keep you sick. You need to understand where it's coming from. And Fauci's wife works for the National Health thing too. So, but anyway, the parents should decide. These guys, all the school boards in Ohio are getting $400 billion of your tax money if they go by the CDC guidelines. I saw that on the CDC website. Yeah, you're getting money. You don't care about our kids. You want the money. You didn't tell us about that money, did you? Yeah. And you know, they don't tell you about ivermectin. That's a cure. Go to America's Frontline Doctors. AmericasFrontlineDoctors.com. And you know why they don't want you to have the cure? Because this emergency vaccine, there's a clause in there. If there's a cure, you can't use that vaccine. That's why they don't want you to know. America's Frontline Doctors, go there. You have no idea what's going to happen in a year. They take 8 to 10 years to test vaccines. You're the test right now, your kid. What's going to happen in 8 or 10 years? You don't know. Looks like cigarettes were good the first year too, until they got cancer years later. And masks, it was 8 out of 100,000, now it's 14, and that's just up to 2019. I bet it's a lot more than that. Almost double for suicides, because how do you feel with a mask on? How do you feel with a mask on? How do you feel with a mask on? Did you look?
All right, thank you. Ann Manzi, next speaker. Thank you.
Thank you. Ann Manzi, 3985 Sunset
Order,
Drive.
please. Thank you.
I'm just going to kind of reiterate some of the things. I'm going to talk mostly about the quarantine because, taking Mr. Sable's recommendation, I called Senator Romachek's office this last week, okay? And according to Senator Romachek in his office, because of SB 22, the Ohio Health Department cannot mandate quarantine policies upon any school district. They can only provide guidelines and recommendations. It is up to each district and school board to decide how they want to implement and enforce such guidelines and recommendations, not the health department. All right? And I see that as the problem right now with what's going on in our school systems, and I don't see how a mask solves a quarantine issue. By masking the whole district, how does that solve us contact tracing kids who are potentially healthy and are being forced to stay at home and not get the education that they deserve? And that's right, and as we paid for. My son came home today from school saying that more kids are masking because they are afraid of closing down and not because they are afraid of getting sick with a virus. They want to be, I'm with you, we all want our kids to be in school. I just don't see how the masking up the whole district is the solution to this problem. We need to address, as Ms. Pavlik said, the quarantine issue and make it, if somebody's sick with symptoms, quarantine them. But that doesn't mean we need to quarantine everybody that sits by them. COVID is here, it's real, it's here to stay, and are we going to keep doing this every time we get a surge? And that's all I have to say.
Thank you, Ann. Over here.
All right, this one. Hi, Rebecca Lewis, 4014 Boxelder Drive in Medina. Concerned parent, obviously taxpayer. I don't even know where to start. Like, this is just so maddening. I mean, it's so maddening. Like, you come in here and test and quarantine. Well, if you're sitting 6 feet away, 10 people have to quarantine for 10 days. But if, like, it's a full moon, then, like, 7 people can quarantine. But if you're wearing a mask, then, oh, wait a minute. Wait, what was that again? Now I forget, you know? Like, this is all, I'm sorry, this is all a bunch of mumbo jumbo. Like, it doesn't, guys, it's just, it makes, I'm an airline pilot. I've been an airline pilot for some 40 years, right? 20 of those years as a captain, I'm up there making decisions to save all your guys' lives in the air when stuff goes wrong, right? I know I don't look like it because now I'm a mom at home and I'm trying to juggle everything. The other 20 years I sat as a co-pilot. Can you imagine what would happen to your airplane when any number of things have happened? I've had a nose gear crunch on me. I've taken off and who knows what happened? Crunch, 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 right? I'm low on fuel. What am I going to do? And am I going to sit here and mumbo jumbo about, well, the health department says quarantine. Well, we have masks. Well, we have to wear masks. Well, our lawyer said this. It's the Constitution. Honestly, how stupid. I mean, how stupid. Marbury versus Madison or whatever the case was. Like, it's so obvious. Just teach the kids, do what you guys do as a school board. Don't stop with the health stuff. The masks, the vaccines, all of that's right. All of this stuff, the vaccine is supposedly it's approved, it's not approved. Who knows what stupid legal games they're playing? The masks are still only emergency use authorization. As soon as you put a kid on in a mask, right, and say this is going to stop COVID, this is supposed to stop COVID, you're experimenting on them. You've got to give informed consent, you've got to give the option to refuse, you've got to do all the Nuremberg Code stuff. We're not doing any of that. I mean, it's asinine. It's asinine. You know what I mean? It's so simple. When I'm low on gas in the airplane, I look, how much am I going to burn between each of these points to the time I get to my destination? And how much do I have now? That's how much I can spin around the air and hold for. Well, maybe the weather lifts or whatever's going on at the airport. Like, it's so simple, you know? And it's like, you guys are all caught up in this stuff. It's all illegal. I mean, most of it is. It's just ridiculous, right? The tests were recalled. In December, we're going to stop using them. They recalled the tests because they're faulty. If the tests were faulty, which we know the tests were faulty from the beginning, guess what? There never was a pandemic.
Thank you.
I was going
Order,
to...
please.
I was going to...
Please state your name and address.
I was
Go
going
ahead.
to speak at the end, but that's appropriate now, and I have 2 other people that I am the spokesperson for, so may I please have 9 minutes? They're on the list. Karen Niger and Jennifer
No,
Webb.
I'm sorry. Every person gets 3 minutes.
Well, can they stand up here with me?
No, we don't cede minutes. I'm sorry. Go ahead. Go ahead. This is not a question and answer time. This is your time to give comments on an item that we're going to vote on. If you have questions and you want to send them to the board, we have through the website.
I have sent them to the board with no response.
Okay.
That's why they asked me to speak on their behalf.
Okay, so who's speaking?
I am.
Okay, and your name, please state
Kim
your name.
Gordon, 6617 Cobblefield Drive. Chronicles 2, 7:14. If my people, which are called by my name, shall humble themselves and pray and seek my face and turn from their wicked ways, then will I hear from the heaven, and I will forgive their sin, and I will heal their land. A message from a friend. Give thanks to the Lord, for he is good. The victory is mine because the battle is yours. From out of the valley will come breakthrough. Give thanks to the Lord, for he is good. I will sing in the eye of the storm. Give thanks to the Lord, for he is good. From the struggles will come triumph. The victory is mine because the battle are yours. From the valley there will come breakthrough, for he is faithful forever. You give beauty for ashes. The victory is mine because the battle is yours. Samuel 1, chapter 12, verse 16. Now then stand and see this great thing the Lord is about to do before your eyes. Father, we ask and agree, whatever the ones hearing this is going through, make breakthrough come from them for them today. In Jesus' mighty name, amen. We, the people, the parents, send our sons and daughters to Medina City Schools, and we have come to meeting after meeting, providing you with educational material from medical journals, and it falls on deaf ears. We are not asking anymore. We have given you plenty of opportunity. We are telling you we choose medical freedom, and we choose freedom of choice. To all you parents, our children, sons and daughters are supposed to, without prejudice, be offered a free, appropriate public education. For goodness sake, students are afraid to come to school with allergies. And did we eradicate the common cold? We told you last meeting our children are being bullied by educators and nothing is done. Did we forget about informed consent? Did we forget about the People's Bill of Rights? Did we forget about health information privacy? Did we forget about do no harm? Did we forget about personal and health freedoms and our constitutional rights? This is an emphatic no. We are standing up for our rights, support individual rights to choose without shame. We have come to school board meetings with information, suggestions, questions to try to work together, but instead are ignored. Several of us have emailed with no response. How much of the $4.5 billion is Medina receiving for implementing these policies? You seem to care more about these funds than our children, but that's okay. We, the people, stand up for everyone's right to choose. You are quarantining healthy students without authority, taking over 72 hours to contact.
Thank you for your comments. I appreciate it. Over here.
Oh, hi. Is my mic on? I'm not sure where I should stand. Okay, this is good. Okay, sorry.
State your name and address, please.
Okay.
Sorry.
My name's Victoria Drewley, and I live on Laurel Glens Drive over off Guilford. I had a whole thing to say, and I've got to say that after listening to you guys talk.
I'm sorry, could you put the mic a little closer? I apologize.
Yeah,
Thank you.
sorry. Is that better? Oh, there we go. Sorry. Victoria Drewley, Laurel Glens Drive, off Guilford. And okay, here we go.
Please give another 5 seconds. Go ahead.
I'm sorry. I can go quick. I just want to start by saying thank you for doing this because you aren't going to win. You're not going to make anyone happy. You're not going to make me happy or anyone else in this room, yet you have to sit here and listen to everything that we have to say. And I really appreciate that. And I understand that this issue has become a political nightmare, and I have a lot of concerns. I have concerns that instead of making decisions out of an abundance of optimism, maybe optimism that people will do the right thing or follow the recommendations, maybe there was a political motive because you all serve at the leisure of the voters. So that's definitely something that crosses people's mind, that maybe you're afraid to make an unpopular decision. And I got to tell you, it's going to be unpopular no matter what decision you make. And we're in a situation where everyone is talking about their freedoms and this and that, and I see signs about communism and whatever. But what I know is that my personal freedoms end at the next person. So my child's personal freedom ends at their body, at the next child, and it is the same with everyone in their classroom. And what the school system is supposed to do is provide a safe learning environment for our children. And regardless of what you may believe, science doesn't matter if you believe it. The data exists that masks work. In the absence...
Order, please. Please add another 5 seconds, Ryan.
In the absence of any other protocols, masks work. And that's why we're in this situation. And I would like to say that I'm speaking.
Okay, please pause for just a second. Please, we request order. Everybody needs to have a chance to speak. If you're shouting over the person speaking, we can't hear what they're saying. And we want to hear what you say when you speak, so please don't shout while other people are speaking. I'm sorry for interrupting you. Please go ahead.
We have the data that shows...
Stop. Please stop. It's not your turn to speak. It's this person's turn. Just wait.
Okay, just let me know. I'm here.
Okay, please go ahead.
So, if you consult medical journals and actual peer-reviewed information that has collected the data from the United States, from the world, and seen what people have been doing during this pandemic, it shows that the best way to get ahead of the virus is to start early and stay long. And both of the plans fall short of starting early and staying long, which is going to leave us at a continued risk. But what the data shows is that in the absence of any measures, in the absence of social distancing or having to close down our businesses or put the children online, masks work. And they work really well if everyone's wearing one. And there is no data, no actual peer-reviewed scientific data that is reputable that says anything about the harm of masks. None. And I would encourage you to consult the experts like you said you were going to do. You were going to follow the recommendations. Now, we've heard tonight that the CDC is political. Well, what about our children's hospitals? Because they're all recommending that the children wear masks in school. Because they're saying, it's right, it's a whole cabal, I'm sorry. But they are seeing increased cases in children, and particularly people under the age of 18. And nobody's dying until it's one of our children, until it's one of our community members, and that's what I don't want to see happen. Because everybody needs proof, right? Do we want the cost of the proof? Because we have our freedom, our personal freedom, our freedom of choice. We do not have freedom from consequences, and that's where we're headed.
Okay, thank you. Over here, please state your name for the record, address.
Hi. My name is Samantha Cottrell, and I live in Wadsworth, but I'm coming to as many board meetings as possible because this needs to be heard. But the reality is we can all stand here and tell you our beliefs, and you can let it go in when you're in out the other. That's more or less what's going on. Our job is to see how these guys are actually voting. Because they're going to vote on this regardless when we're done. I went to the Wadsworth one, they voted on it regardless. They had their say. We get to talk, but we don't have a say in how they vote. So our job is to see how these guys are voting, so then we can see which ones are actually the ones that are on our sides. So then when the next one comes up, we can get the ones that aren't actually doing their job right, the ones that are a part of it, out of there. So right now, tonight, guys, your kids are going to be mask mandated because they've already made up their minds. So your job as a parent is to either A, stop getting your kids tested, B, stop sending them to school, get them out so then they can actually stop having their funds, because they're only getting their money if you send their kids to school. So if you can, make a co-op. Get your parents together to where you're educating your kids, getting them the education that they need to. We can do this with the community without these guys. They're paid by us. So we can sit here and talk. You can tell that the good majority of us agree. There's a few that don't. That's fine. They're entitled to their opinion. But at the end of the day, they're going to vote on it. They're already decided they're going to vote on it. So we can talk all we want, which is great. We all need to know who's on our side, but they're not. There's a few of them that are, and that's awesome, but at the end of the day, we need to get the ones out that aren't going to be doing what we need them to do. So make yourselves aware, educate your kids, stop masking them, stop testing them, because the tests don't work, we know it doesn't. And if your kids are sick, keep them home. If they're not, send them to school. If they do get sick, go to AmericanFrontlineDoctors.org, get on HCQ or ivermectin. There's vitamin D, zinc, chloroquine. There's so many things you can get your kids healthier, because the reality is they're doing their job, they're sitting up there, we voted them in. Let's get the ones in that are actually doing the job that we like and that we want, and get the ones out that aren't doing their job. Because they're gonna vote on their option 1, they already did that, they already picked the option 1. They're gonna vote on it, and your kids are gonna be masked. We can sit here and say that we disagree, but they're the ones that are voting, not us. We voted on them. So we need to find out who's voting onto what, we need to know where they're at, and get the ones out that don't need to be there next time. But right now, we need to take control of our kids, and again, get them healthy, get their immune system healthy, get a co-op going, get your parents. I already pulled my kid from school. She's gonna be doing homeschooling, and I just started my own business the same week. So I'm gonna do it, and I'm gonna work with other parents, and I'm gonna work my butt off to make sure my kid gets the education she needs, and that's what everyone else needs to be doing too. So let them sit up there in their little outfits and masks and do what they need to do. We can get the real people in there next time, because it's not gonna work. They've already made up their choices.
Okay, thanks. Over here, please state your name, address.
My name is Tammy Priatelli. I reside at 415 Providence Drive in Medina. The flowchart created by the Ohio Department of Health and currently used by Medina City Schools to quarantine and remove students from school is flawed for many reasons. My son attends Medina High School, and on August 27th, we received a call from school to pick him up. Apparently, he was contact traced to another student who tested positive for COVID. Our son was very upset about this. He didn't understand why he had to leave school. He wasn't sick. He had absolutely no symptoms all week long. Contact traced back to someone on Monday, and we got a call on Friday morning. Our family had no symptoms whatsoever either. We were not sick, and I knew my son did not have COVID. I called the school administration and was walked through the flowchart protocol created by Ohio Department of Health. I was told my son could be tested the next day on Saturday, which was Saturday, and if negative, he could return to school on Tuesday. Tuesday. Did anyone catch that? I asked, why not Monday? That makes no sense. If he had a negative COVID test on Saturday, why couldn't he return on Monday? Does anyone else see a problem with this? Okay. I challenged it and was told we are following the flow chart from Ohio Department of Health. No school administration would stop and discuss the question. I continue to get a pat, pre-scripted protocol response back to Ohio Department of Health flowchart. If my son tested negative, he feels good, he's not sick, he's not symptomatic, why couldn't he return to school on Monday? Nope, Tuesday, going back to that flowchart. Because fear has replaced common sense, rationale, and logic. This flowchart prevented my son from going back to school on Monday because the school administration did not have the courage, the concern, or common sense to stop and say, you know what? You're right, that doesn't make a lot of sense. Your son tested negative for COVID, he should come back to school on Monday. So my son missed 2 days of school, and the online learning for many classes was not set up, not conducive for learning, so he missed 2 days of learning for my son, totally unacceptable. He missed 2 days. I wonder how many days kids are missing. How many days are our kids missing because of this? 3, 4, 5, how many? Flaw number 2, doesn't take into account anyone who has previously had COVID and their natural immunity. Natural immunity has found to have affected way more than 90 days. Could be years, it depends on the individual. A board member in August brought this up and said that this should be taken into account in the flow chart. I don't think this ever happened. Third flaw is that this flow chart is discriminatory and biased. Students are punished for not wearing a mask, punished for not being...
Thanks for your comments. Over here, please state your name and address.
My name is Stephanie. I live in Crimson Harvest. I just kind of wanted to bring something up because I don't know if anyone else noticed it.
We all signed up, like on a sign-in sheet, right, to talk at this meeting. Did anyone else notice that everyone used the same pen? My nail salon has a different pen, the used pens and the unsanitized pens. A nail salon. Now, does that make sense? No, we all know the answer to that. That's no. But I'm sure that'll probably be fixed at the next meeting, of course. I'm going to move to a different side. Medina High School has a significant drug problem. No one else wants to bring, no, it has to do with the mask, don't worry. Okay. Thanks. No one else wants to bring it to light because everyone else is too concerned if little Jimmy sneezed next to Timmy or not. So people could understand what's really going on, and maybe kids are resorting to that. And the drug problem is at the school. They're doing the drugs at the school. Ever think that that's probably because they're sad? Because half the time, half their friends are gone because it's contact traced, whatever. Just an idea. So this is kind of funny. My 11-year-old, so this is a little silly, but my 11-year-old brought up a very good point to me, and I told her I was going to bring it up, and she said that was so embarrassing, but I don't care. So she brought up the best point ever. She said, "Hey, Mom, if a fart can pass my butt cheeks, my underwear, and my pants, why do I have to wear this dumb mask?" And I'm like, you know what, girlfriend? You're going places, because that is a great point. And why was MODA never brought up as an option? The online schooling? Because I'll be happy, well, A, I'm not going to pay property taxes and not benefit from it at all, because at that point, I just might as well move me to Florida, where they have a lot more sense than here in Ohio does. But I'm assuming you guys did take the funding money, right? We'll wait to hear those answers. Thank you.
Okay, thank you. Over here.
Yeah, my name is Rob Rockhorse, 142 Coons Avenue. And I came in here mad as hell, ready to fight. And as I listened to you guys speak, I really listened to everything you spoke about. And what I noticed is you guys are speaking like this COVID thing is new. You're just now trying to figure out the data of mask and all this stuff going on. This has been going on for over a year. You guys should already have the data for that. So it shouldn't be that we determine if our kids need to wear masks now or not. We already know. This is all political, and I listened to you speak, and especially you, Aaron Sable. So I'm here first to say, as we the people, we need to vote him out because he is political. This whole thing is political. All you guys are doing is virtue signaling. Kids don't need to wear a mask. It is not helping any kid out here to wear a mask. You're doing nothing for them but bringing a burden on these children. And you don't think about that because you're saying these masks work. Where's the proof? Somebody show me the proof the masks work. Right now, that you're here, that you've prepped for this whole thing, show me the masks work. You've had over a year to prove it. Now prove it. That's all I have to say.
Okay, over here.
Christy Dunmeyer, Orchard Lane. I have nothing prophetic to say, but from a personal experience, we had our son quarantined as well 3 days after exposure. We got a call on a Thursday evening after he was exposed on a Monday. When we questioned the assistant principal from the high school, she refused to give us the information on where he was exposed because my son was questioning where he was exposed because he couldn't remember anybody around him absent. And you make mistakes, we're all human. The assistant principal refused. I reached out to the superintendent and the assistant superintendent, and I just got an answer Saturday night after he's been back in school all week of where he was exposed. Well, of course he doesn't remember, but when I sent him back to school, homecoming's at the end of the month. Sophomore, freshman year, he didn't get to do anything. He wants to go to homecoming. What did I tell him? Put the mask on, because if not, you're gonna get targeted for quarantine again, and you're not gonna be able to go to homecoming. So he's playing the game so he can go to homecoming. I wish you guys would just not vote tonight and leave it optional. Let parents who want their children to wear masks do it. Let us who want to let our kids, my son's 15, he can make his own decision. He wants to wear a mask, I let him wear a mask. If he doesn't want to wear a mask, don't wear a mask. My middle schooler has no choice. He's at Root. He has to wear a mask. He hates it. Came home Friday with a headache, he was coughing, he didn't feel good. All weekend he was fine because he's so stressed about wearing the stupid mask. He does not want it. Let it be optional. Let me make the decisions. We all had COVID. My whole family had it. We're fine. Let me make the decisions for my family and let all these other people make their own decisions for their family and let our kids go to school. You're not going to make them wear masks at the football games, and I love the football players, and I love the band kids, and I love the soccer kids. I love them all. But you're not going to have them wear masks at Swarm. You're not going to have them wear masks at the football games, the thousands of people that go to those football games, and you're not going to shut down the football games because it brings in a lot of money for the OHSAA. Let's face it. That's why we had a season last year. My son played last year. We had a season because they wanted the money. Just wait on it and let it be optional and let us parent our children. That's it.
Thank you. Over here.
My name is Scott Quaid. I live in Wadsworth, but I'm a stakeholder in the schools, having worked here for 33 years. I'm not going to talk about masks. I'm not going to talk about conspiracies. I'm not going to talk about voting people out, including someone who is not actually an elected official. I'm not going to talk about any of that. I just wanted to mention a procedural item that goes to the point that we were at before the public address part. There was a motion. It's been seconded. There was some discussion, and a board member, and I know I'm not naming names or anything, not pointing to any specific person, a board member had a question about possibly amending that motion. From what I could hear back there, which is somewhat limited these days, he was told that maybe now's not the time to do that, let's move on with them as they are. Robert's rules do allow for any of the board members to go ahead and make the motion to amend. My understanding was based on possibly altering the date of revisitation. The person making the motion, the original motion, could accept that amendment without any further debate if they want, if the second also accepts that amendment. And then we could sort of move on from there. Just throwing that out there as a thought in case not everybody was familiar with Robert's rules. Thank you for your time.
Thanks, Mr. Quaid. He's one of our exceptional teachers and leads the debate team at Medina, so he is quite an asset to the district. Next, over here.
Hi, my name is Pete Toth, 1179 Letstone Drive, and I have grandkids, including a 5-year-old, a 2-year-old that live with me. Now, you guys have your agenda. I'm sure you guys have your agenda, but we're all fear-mongering right now about COVID case and quarantine. Mr. Ross, what's a COVID case? What is a COVID case? You guys, all these numbers, you with the blue mask, diaper, you know, it gets dirty, you replace it, change it. I mean, that's what you guys look at. What is a COVID case? You brought all these statistics up. What is a COVID case? I've got 2 minutes and 22 seconds. Do you guys each want to take 10 seconds to give us a COVID case that we're fear-mongering today? Mr. Ross, go ahead.
Sorry, this isn't
You can take your mask off and tell us what this COVID case is that you're fear-mongering to quarantine.
Okay.
Do you know what a COVID case is?
Mr. O'Call, can you pause this time? Please, this isn't question and answer, but feel free.
Okay, I'm just asking if you could set up. I do know the Judicial Watch has the Freedom of Information Act. They're suing the CDC to have they ever isolated COVID. They don't have an answer. I mean, what are we looking for? The flu? Oh, this year we never had a flu case. Wow, we cured the flu. But what is a COVID case? I don't know. Is it a bubonic plague or is it a traffic ticket? I mean, you guys are staring at me. I'll step down. For the next person comes up, you guys got 90 seconds, tell us a COVID case and explain it to us what you're talking about. Thank you.
Thank you. Over here, please state your name and address.
My name is Julie Sems, 4891 Timber Creek Drive, Medina, Ohio. I am a parent. I have a child at the high school, and I have two in private. And I just had a question and a couple points to make. Is there any way that we can get the data as far as previous school years in the beginning of kids getting sick? I know that that is not an uncommon thing for kids to start in August and September, and we hit the colds and the germs and the whatever else is going around because it is the emergence of everyone coming, the kids together. I think that would be a really good point of data for everyone in the community to kind of see what other previous school years look like as far as sick absences go. I also think that we should see if we can get the data for, I believe it was the 2018-2019 fall and winter season for sick absences. I very distinctly remember, I believe it was in January, February of 2019, where pretty much half of Claggett it felt like it was kids homesick. And I very specifically even remember my daughter calling me, telling me that she didn't feel good, and she went to the nurse's office, and the nurse sent her back to class. And so the only reason I came to school to pick her up was because she was crying and she really felt ill. So I really feel torn with the fact that all of a sudden there is a huge concern for kids who are sick, but yet when my child presented to the school nurse sick during a heavy flu season, she was sent back to class, and I had to go to the school and call her out because she had texted me. So I think it would be important to know for the rest of the community to kind of see the numbers. What were the numbers back then? So we can kind of see what that looked like compared to what it looks like now. I also want to say that there's a lot of passion here, and I don't envy any of your spots. And I think it takes a lot for a person to come up here and speak, and whatever their passion in whichever direction that it lays in. But as you sit up there, I think it's really important for you, most of you, make really good eye contact and look at the parent that's sitting up here. But I have seen one specific board member who has checked her watch and has checked the board. And I think it's very, very concerning that my time up here, as well as other people's times up here, seems to not be valuable to that board person. So that's all I wanted to say. Thank you.
Thank you for your comments. As the presiding officer, I see we have two individuals here and one individual here. As we complete I'd like to bar continued comment beyond those that have stood right now that are here. So please go ahead and continue. And then we will then have a vote. And then later in the agenda, we still have a public comment. So some of you have signed up. You might be here about a different topic. And if you are, that's fine. But we'll still have a public comment. But we want to have our vote here at some point soon. Go ahead. You have your 3 minutes. Please state your name.
My name is Anita Praisler, and I'm from Medina. And the reason I came up is because you had asked specifically for respect from the crowd. But to piggyback on what this young lady had said over here, I have not seen respect because I have seen you check your watches, I've seen you on your phone, I have seen you on your computers, I have seen you talking back and forth, not paying attention to what each individual is saying. So that, to me, is already assuming that you've already made your decision. Okay, that is disrespect. You're asking us for respect to you. We're going to ask that for you. Okay? And I have seen Mr. Sable. I do not know you personally, but I have seen you check your mask, touch it, move it, a minimum of 15 times. I'm not exaggerating. I am serious. The thing of it is, you're touching everything that you have in front of you. You're drinking stuff from your glasses. It's sitting there. Are the germs jumping off? I mean, you're wearing your mask. That's your right. That's your privilege. it is ours to not wear one as well. And those that do, that's no different than a diaper, because a diaper contains what? Bingo. We're talking about voting on this, okay? It's clearly breaking the law. It's the Constitution of Ohio, not just the United States, of Ohio, where it says, Article number 1, Amendment number 1, all men, by nature, free and independent, and have certain inalienable rights, among which are those of enjoying and defending life and liberty, acquiring, possessing, and protecting property, and seeking and obtaining happiness and safety. That part of protecting property, that's our children. That's our family. You have no right to overstep those boundaries. And you are. You have no right. You have no God-given right. You have no man right. And for each and every one of you that is standing there on your hierarchy of power, get real. These are lives. These are tender, young lives. Do you realize how you're destroying their spirit? Shame on you. You have the data. My goodness, I've had COVID. My husband's had it, my family's had it. By grannies, I'm still here. 99.9% survival rate.
Thank you. Over here.
So my name's Chris Hastings. I have 2 students in the high school. I emailed you, and I'm sorry if I was really angry when I sent it, but this whole topic makes me
I'm sorry,
angry.
could you restate your name and address?
I did. I said Chris Hastings. I'm not doing my address. I live in Medina.
Okay.
Okay, I'm sorry. I'm a little weird about that. Anyways, I work in surgery. We wear masks, so I'm going to educate you a little bit on them. I can take a mask and I can hold a glove to it and blow it up. Everything that you breathe out goes through your mask. The virus is like less than 0.4 microns or something, so it's not working. But I have had a chronic cough, so have all my friends. It's right here in our throats. We all talk about how we're breathing in fiberglass. These masks are made in China, just so you know, they're disgusting. If you ever look at them under a microscope, they're very gross. Nobody should be wearing them. Nobody should be cutting off their oxygen. Oxygen helps fight cancer. So you guys are all, when you wear them, you're getting more sick with other things. So I just wanted to say that about the mask. As far as your data plot thing that you have going on, that is messed up, okay? I taught science, I know science, everybody here is lots of people who know math. If you're gonna include quarantined, healthy children in your plot map, it's gonna be wrong. All I want you to do is plot out the actual sick kids, not the ones who ran and got a test because they went, okay? The actual sick kids, that's all you gotta look at. And I just wanna know those numbers. That's what we wanna know. I don't wanna know how many kids you quarantined because you did it and it was wrong. It's unlawful to quarantine children that are healthy and they're not sick. You're denying them an education that, like the lady said, was a God-given right. Okay. So you obviously have already made up your minds. I'm sorry that you've already made up your minds. It's the wrong decision. As you can see, there's a lot of people who are going to fight you on this. And I just want to encourage everyone to, A, send your kids to school without a mask. They don't have the right. They don't have informed consent. I never agreed to let you doctor my children. I never agreed to let Medina County Health Department or the Ohio State Department to be medical doctors. I've never given informed consent for that. You do not have the right to tell my kid to put a medical device, and that is what it is. It is a medical device. You have no right. I'm sending my kids to school, and we're going to have a problem if you send them home. I'm not doing that. I'm not okay with it. I'm taking a stand right here. Do not send my child home if they come without a mask.
Okay, thank you. Over here. And we have the last one up over here at next.
Hi. My name's Nicole Hallam. I'm from Wadsworth. I won't need the whole 3 minutes. I just want to say I'm sorry, but most of you up there need to be ashamed of yourselves and what you're doing to our children. Masks are ineffective, as well as I know 2 women that their daughter got an infection on their cheek because of having to wear a mask all day. I would like to know, because all of you look around my age, so we were all taught as children, the first thing that you need in order to live is fresh air. Why is it an adult can go out but does not have to wear a mask, but a child all day long in class? That's disgusting. That is shameful. And I hope to God that those of you, sir, that pushed the 700 cases or whatever, you sound like Fox 8, first of all. Second of all, I would like to know what happened with those 700 cases after they got over the COVID, because we don't die from COVID. Our children, 99.8% chance of survival. If you have a fear of it, then keep yourself at home. Leave your job. I would not want you, ma'am, teaching my daughter. Thank you.
Thank you. Okay, and our last one for the public comment. Please state your name and address. Thank you.
My name is Linda Kelly, and I'm from Sharon Center. And I've been listening to all of this. I've been sort of watching this whole COVID experience on a broad spectrum. And I want to say the thing that there are lots of things that make me mad. There's a lot of things that make me sad. But the things that make me the saddest is not even in your statistics. And as you vote, I want you to think about this. The things that are the most harmful for students is the depression and what is the rise in suicide.
Thank you for your comments. Okay. All right, Mr. Chambers, please call roll on the vote for option 1.
Ms. Parkhurst?
Aye.
Mr. Ross?
Aye.
Mr. Harrison?
Nay.
Ms. Pavlik?
No.
And Mr. Skidmore?
No. Okay. Does the board have a desire to entertain option 2, or shall we proceed on? Mr. Sable, would you like us to entertain option 2?
I think there's actually a motion on the table already.
Well, it died because it didn't get a second. So if we don't have that tonight, then I think we should proceed and have public participation. But that's up to you if you want to recommend that we look at, I don't know how the rest of the board feels about option 2. I have no idea.
I recommend that the board take a look at option 2.
So shall we discuss option 2 then? Is that the pleasure of the board? You want to discuss option 2?
I think we had a motion.
I made a motion. I'll remake the motion that we approve option 2. If there's no second, I don't hear a second, so I think it dies. So I'll hold on for 1 second.
Sorry, I'm sorry, can you repeat?
So in other words, I made a motion that we approve option 2.
And you need a second?
If you
I'll second.
Mrs. Parkhurst seconded that. Okay, so we have a first and a second. Questions or comments from the board on option 2? By the way, we may have to take a recess here in a few minutes, if you guys want to. It's been since 6 o'clock, so it's 2.5 hours. So if any of you want to.
I will need a
sorry,
recess, Mr.
please,
Skidmore.
Please. You would like to?
A recess, yes, please.
Would you like to do it now or later?
Whatever's most
in a few
convenient for
minutes?
you. That's fine.
Okay, if we, maybe, why don't we briefly have our comments on option 2, and then let's take a recess, and then we'll have public comments on option 2 before we vote on option 2, okay?
That's fine, thank you.
We'll just do a brief recess for that purpose. We won't discuss option 2 in the hallway. Everybody just does their own thing. We're going to go do a recess. Okay, so questions on option 2. I guess I'll lead out and say, again, like I said earlier, I'm not a fan of masks. I understand a lot of the positions in the audience. But again, as a pragmatic person, I want kids in school. I don't want them online. I think last year our mantra was education is essential, and I believe that. I believe education of students is essential. I believe that an online education is not as good as an in-person education. I believe at times if we have these mandates, sometimes they go beyond their useful life. Excuse me, you'll have a moment to speak. Order, please, order. Okay. Option 2 we're discussing right now. So everybody on here, on the board, will have a chance to talk. So on option 2, the point is that I'm afraid sometimes when we have these mandates that they go beyond their useful life, that kids can't use a locker, and it's beyond the time period of where it's reasonable. So I think it's good that this, again, we sunsetted it in the spring. We were happy about that. We were also all under the impression that this COVID thing was in the rearview mirror, that the vaccines were going to be perfect. Nobody would ever get COVID again, and we can't affect that. That's beyond everybody's control that's here tonight, okay? But what we can do, I know you guys have signs about oaths. What we're here for, we're oath bound because we want to educate kids. That's why we're here as a board. And option 2, I think, balances that. It's doing what Mr. Sable enacted a week or so ago, and I think you gave a courtesy call to myself and to Becky and said you were going to do that. You didn't call the whole board. We didn't make any board decisions, but you gave us courtesy call, and I appreciate that because you give us good communication as a board. You do a great job with that. So what I would say is option 2, and we could argue for hours about what percentages they should be, that they should or shouldn't be, but the point is that we'll get to reevaluate this also at another meeting. The data will be reevaluated by the Board of Education Administration at each work session, okay? So that's not something we really want to do, but we're gonna have the ability to do that at each work session. We can reevaluate this option 2. But instead of, if we have a school that has no outbreak of COVID, that I guess the masks are still going to be encouraged because you have a campaign to encourage them, but we're not forcing kids to wear masks. We're not forcing them to wear them, okay? So I agree with that. I think that's a great position with that. And again, the asterisk down at the bottom, we're exempting sporting events, board meetings, things like that. And you know, I think the reality of what we saw last year is there wasn't a lot of spread at those types of events, that wasn't happening. And so there is this recommendation. Again, the administration's prepared both option 1 and option 2 as options for the board to look at. Option 2 is what we're currently doing, and there's a lot of people that didn't come tonight. They're concerned. We've gotten lots and lots of emails from people that think we should do option 1, and some have said it should be for the next 5 years, and I disagree with that, okay? I disagree with that. I think it should be a temporary period that we do this, if we do it, and I think it's based on the fact that as this is in place, then this should go away very shortly. But it's temporary. Just like Mr. Sable has the ability to declare a snow day. Mr. Sable has the ability to say that the school needs closed because too many people are sick. If too many people get sick, you can't even operate a school. You won't have subs, you won't have teachers and so forth. So this is very important for, I'm sorry, you'll have a moment to speak in a moment, just wait, okay? So the point is, that's where I'm at with option 2. And I don't know if we want to go down the line. Val, where are you at with option 2?
Yes, in the past, we've always reserved the right to change our mind, and I'm still a no on option 2. The way When these percentages were talked about with me on Friday, it doesn't reflect what is in here now. We had talked about the 10% at the high school. Also, too, it still says at each work session. I'm not comfortable going a whole month. I don't think that we are addressing the root problems with the local health department. I was hoping for different news too, as far as the pilot program that Warren County is doing. So I don't have confidence that in this, what is being presented.
Thank you, Mrs. Pavlik. Mr. Harrison?
I tend to agree with Mrs. Pavlik on that. I'm still not going to be able to vote for option 2. I come at it from a little different perspective, and that is back at our first meeting, well, my first meeting, I should say, which was before school started in August. We made the point that our recommendations were consistent with the applicable recommendations from the Ohio Department of Health and CDC, which is a strong recommendation that everybody wear masks. As we sit here today, we're requiring masks, but that strong recommendation is hard for me to move off of without some additional insight directly from the health department explaining to me why their recommendations are wrong. I wouldn't be inclined to do less than what they require. I'm also not inclined to do more than what they require without some direct insight from them on that topic. So I'd have to vote no right at this point.
Thank you, Mr. Harrison. Mr. Ross?
I've said this several times, not tonight, but throughout my career here as a school board member, that when I vote with my heart, and then I vote what I think is good for our kids, our staff, and our community. And what I said tonight was our optional plan that we started the school year with is not working. And so I'm going to support the pivot to see if we can do something else that's going to change the numbers, because the COVID numbers are surging. And whether you disagree with that or not, it's just a fact. And so my heart says we got to do something different to get this under control. So I'm going to support it. Thank you.
Thank you, Mr. Ross. Mrs. Parkhurst?
I appreciate everyone's comments and passion this evening. There are a lot of, as Mr. I think Sable and Mr. Skidmore said earlier, we've received a lot of emails, phone calls, conversations with lots of people who aren't here. And we're not going to make everybody happy. And our job is to do the best that we can, do what is best for kids. And we have to do what we feel is best for the majority of our students. I agree with Mr. Ross that we need to do what is best for kids. We have to do something at this point, and I will support option 2.
Okay, so you commented earlier on the percentages and so forth, and again, I don't know if you could just give like just a very short recap of how we arrived at that. And then what I'd like to do is go ahead and we'll just take a 5-minute recess, and then we'll come back, and then if the public would like to address the board on this option 2, again, we'll have the same way that we handle this, where you come down to the mics. Please, Mr. Sable.
Yeah, the percentages that are implemented are based off of absences due to COVID. So the percentages include absences due to positive COVID cases, as well as quarantines outside of school. They do not include any absences for any other reason. So if a child is out of town, that's not included. If a child is absent due to another type of illness, that is not included. The reason why the percentages are varying is because the way quarantines occur. Down at the elementary level, they tend to hit an entire class, where at the upper grade levels, they tend to span multi-classes, so they're less impactful on individual classes because the students change classes.
And Mr. Skidmore, to provide perspective, that's the data I presented tonight, just to give people a baseline.
Thank you, Dr. Kwolek and Mr. Sable. All right, at this point, I'm going to declare a 5-minute recess. Let's come back on about 8:45. Thank you. Okay, Ryan. Okay, it's 8:49, and we're going to open it up for public comment on our vote for option 2. So if you would like to address the board, we have one down here at the lectern. Please state your name and address. You have 3 minutes.
Okay, so my name's Megan Hyde. I live at 909 Norwegian Wood. I've spoken at several meetings with you guys. So last meeting, I'm sorry to address what Mr. Sable said at the end was very stern. If you want your kid to stay in school, put a mask on him. I questioned it at first. And then all of a sudden the next morning on Facebook, people are saying their kids are getting sent home even though they wore masks because 15 minutes of lunch they took it off. So what's the point? Literally that 15 minutes got them to be sent home. The woman earlier addressed that the Ohio House Health Committee got together and addressed the Franklin County Board of Health. I have sent this video to the board. And the Franklin County Board of Health was questioned if they are the ones quarantining the children. And they specifically said we are only allowed for State Bill 22 to quarantine the medically diagnosed with COVID. We are not allowed to quarantine the healthy kids. So is that maybe why the Medina County Board of Health person isn't here? Because maybe they would be questioned about that and not be able to say that they're not really quarantining our healthy kids? I'm also wondering, you say there's 94 positive and 361 quarantined, and we asked you to show us who actually has been positive for COVID after they were quarantined. Are you afraid the numbers are going to be so low that you're like, oh man, really, should we have quarantined 361 kids who really got nothing wrong with them? Personally, that happened to my child last year, and he spent 10 days in my office lobby with me at our company, learning nothing pretty much than a 30-minute read a book with your teacher. Also, you wonder why the numbers went up. Medina Board of Health on the 21st posted on Facebook, please come to all of these testing centers with or without symptoms. In the beginning of COVID, we were only testing with symptoms. I am a nurse, and my nurses had to lie about having symptoms to get tested because they only had 2 out of the 5, and that wasn't enough. But now just test everybody. And on Facebook, parents are saying, my daughter was congested last night. I went and got her a Rapid. My son said he had a sore throat last Sunday. I kept him home, and I treated him with Mucinex, Zyrtec, and some Benadryl. If these parents need help and me showing them how to treat their kid at home, I'm more than happy to help them. If he had gotten a fever or any other conditions that would warrant me taking him to a doctor or testing, I would have taken him. But I tested my kid at home. I kept him home for 2 days to avoid him quarantining any other students and for him to get quarantined. And I treated him myself because the common cold and allergies really still do exist. I do appreciate you letting us speak for a minute because I was quite afraid there that you were going to really vote before you actually heard our voice for a second. Your quarantine process does not work. A kid is exposed on Monday. The parent is not called.
I'm sorry. Time's up. Thank you. Over here.
I'm going to try to keep this as simple and straightforward as possible. We did send our kids to school every single day since the mandate has been made, and they were sent home every single day. They barely made it to their classroom before they were sent home. At this point, we have to try to teach our 7-year-old and our 5-year-old how to stand up for their rights. So it's kind of a blessing in disguise at that point. But they're brave, they're bold, and they're doing it. And they're willing to stand up to authority and what's right for them. Now, we've already mentioned a lot of things that I was already going to hit on. The fact that statistically this is a 100% survival rating for kids, which makes it really hard for me to swallow when you guys say it's for the safety of them at this point. But also, too, I'm a doctor. I'm a practitioner. So when somebody comes into my office, if I do not give them an informed consent, telling them the risks, telling them the benefits of the treatment that I can provide them, I'm already in big trouble. If at that point, I don't give them the informed consent, and I force them to do the treatment against their will, wow, I'm already at this point unethical, and now I'm getting my license stripped from me. At this point, this is exactly what you guys are doing by forcing a medical device upon our children without informed consent, without explaining the risks and benefits of either side of things. And on top of that, it's through a coercion in order to get them to do this. Because one, we've already made it clear, and by sending them to school and you guys sending them home, we already have proof that there's coercion at that point, because you are literally saying you either get the mask or you go home and you don't have school. So you guys are already in big trouble with that already. At this point, again, if I treat somebody against their will and I inflict harm on them, they have every right to sue me and go after me. At that point, I have every right to sue you and go after you. And if that's what needs to be done, that's what we'll do.
Sir, we didn't get your name for the notes, your name and address.
Sorry, my name is John Bernowski. I'm here in Medina.
Thank you. All right, over here, next.
Okay, my name is Anita Praisler. I know that you don't know me, you don't know my children. You probably don't know half of their children that belong to these folks out here. Do you know our medical needs? Are you a medical doctor or professional that's been trained to give medical advice or recommendations? Notice I said advice or recommendations, because even doctors can't make requirements for patients that they know and treat. A medical device, that is what a mask is. You have no right, okay? However, many of us here know someone that knows each of us intimately, right down to the hairs on our head. His name is the great physician, the one who has knit us from our mother's womb. He is the great I am. He searches the mind and the heart. He is the one who has given us the air that we breathe, the land that we walk on, and the beauty of his creation. He is, quote, the author of all life, and none of you have the right or the authority to take or restrict the air that the good Lord has freely given us. God asked Job, where were you when I laid the foundations of the earth? That's powerful. So I ask you, where were you when God laid the foundations of the earth that you would have this kind of power? All you have the audacity to think that you have the right or the authority to take away God-given rights. That's incomprehensible, no matter what stage of life you're in. Okay, Holy Spirit, fill this place. We need you now. Please pray with me. Heavenly Father, humble all the hearts of those that call upon your holy name. Lord God, we ask you to watch over and protect the innocent lives of the children you have blessed us with. Lord, we ask that you stop this evil that is consuming the hearts of these people that have turned a blind eye to your word and your will in greed and selfishness. In the face of evil, even behind closed doors, Lord, you are in control. In Ecclesiastes 12:14, you remind us, quote, for God shall bring every work into judgment with every secret thing, whether it be good or evil. God, please help your children overcome this evil. God, you have the final say. We give you praise, honor, and glory to our Lord and Savior, Jesus Christ. Amen. My sincere request is that the next time you're in the presence of the Lord, whether it's at home, behind closed doors, in a moment of need or despair, in church, and most importantly, at the communion rail, where you must remember, he who eats and drinks unworthy is eating and drinking their own condemnation. May you truly search your hearts for the will of Almighty God. Remember, eternity is a long time, and it has two destinations. God will hold us accountable for all of our actions. That's for every one of us. Every knee will bow. God is in control. That is real power.
Okay, thank you. Over here.
Hello, my name's Christy Grimes. I live here in Medina. Thank you, sir, for talking about informed consent. I think that's very important for everybody to keep in mind. But I did also want to mention that masks are not without issue. They are not a harmless thing that people just put on their faces. They do cause harm. And research has been done to prove that. Some of the side effects of wearing a mask include hypoxia, hypercapnia, so that's decreased oxygenation and increased carbon dioxide intake, shortness of breath, increased acidity and toxicity, activation of fear and stress response, rise in stress hormones, immunosuppression, fatigue, headaches, decline in cognitive performance, predisposition for viral and infectious illnesses, chronic stress, anxiety, and depression. These are things that you are potentially causing our children to experience so that some of you feel better about yourselves. So please keep that in mind as you vote on the second one, because it's not without harm. Thank you.
Thank you for your comments. So as the presiding officer, we have enough for about 18 minutes more who are standing now. I'm going to cap it at who's standing to go. Sir, you're up.
You guys don't need me to tell you who I am. The young lady behind me just mentioned eternity. I'm going to just quickly let you guys know what eternity really does mean, because I can't get past this fact. Imagine if you had one friend in this world, and that was a bird, we'll say a seagull. You guys were both up on the moon, and everything here on this earth is nothing but flat land with 6 feet of sand. If your best friend had to leave from the moon every single day and come down to this earth and pick up 1 grain of sand and then come back to the moon and drop it off to you, because those are the only 2 people that are alive, imagine how long it's going to take that bird to pick up every grain of sand on this earth, to bring it back up to you, to just start all over again. So what you guys are reaping right now, that is the harsh reality of what will be waiting for you on the other end. But the reason I was so upset today is on Wednesday, I'm an open book, guys. My daughter tried committing suicide. Okay, this is why I'm so upset, because of the main fact of depression of what just happened to her at school. And I'll tell you right now, she fought for her life till Friday night, literally, before she was moved out of ICU, okay? Because she's been sent home for quarantine, along with my other 11th grader, Reagan and Riley. They've been quarantined because they sat next to somebody who you guys thought had COVID, okay? That's why they're at home. My worst fear is when they come back to school, are you guys just gonna send them right back home because you guys are targeting people without a mask? That reality came true with another parent telling me that's exactly what just happened to her son. So this is a game to you. And I'm gonna tell you, Mr. Sable, we're gonna hopefully, with everyone's help here behind me, I'm gonna start the same thing they did in Mayfield. We're Medina. We're better than Mayfield. Mayfield literally has a class action lawsuit going on to hold the people like you responsible. And I will tell you one thing, you can't make it, you cannot make it at an all-inclusive vacation. You'll never last with the big boys. You hear me? You will never. You are not built for that. So respect these children. Don't send my kids home anymore when they come back on Thursday.
Okay, next, over here.
Julie Sims, 4891 Timber Creek Drive, Medina, Ohio. A couple points I wanted to make that I didn't at the last time I spoke, but I did want to reiterate, the first mom has said that, you know, as I was listening to Mr. Harrison and Mrs. Parkhurst, kind of going back and forth about the COVID protocols, and that they were either helping to reduce COVID cases or to reduce so much as the kids being in quarantine. But, I mean, Mr. Sable himself did say at the very end of the last board meeting was that basically, if you want your kids to stay in school, they need to wear a mask. And I hate to bring that up, and I hate to throw it at the board here, but that is what he said. And so you kind of have to see that perspective as all of us parents are sitting here, and you want to tell us that it's for the safety of our kids when the superintendent himself has said that you want to stay in school, you need to put a mask on. So please consider that as you're considering this option here, because I have very little trust at this point in time. I am urging you to please table this, to wait, because it has only been 3 weeks, as you have said. And again, I would like to know the numbers from previous school years of how many absences, sick absences, within the first month and a half to 2 months. Because I really feel that we're going to see, yes, you're going to see cases. You're going to see COVID cases. You're going to see colds. You're going to see, bronchitis. My daughter has asthma. Bronchitis is not unfamiliar to her. You see allergies. I mean, we're sending kids home for every single thing that is listed on that checklist. I mean, stop and think, please. I'm begging you to stop and think before you send these kids home. Okay? This is just, I'm asking you to please table this and wait. Let this ride out. Kids, that are in the hospitals, they're in the hospitals not because of COVID. I know, I am a nurse. I have talked to nurses out in the field, and it is not because of COVID. They're in there for other reasons. There may be a few that are in for COVID, but that is not the primary reason. Please, I am urging you, before you make changes that is going to affect the emotional, mental, and physical health of these kids, and making them slap on a dirty mask that they're going to be touching all day long. Think, please, I am begging you.
Okay, thank you. Over here, please state your name and address.
My name is Teresa Durst. I live in Brunswick. I have grandchildren that attend the Medina City schools. First, I want to say I am in 100% agreement with you folks that we want to keep all our kids in school as much as possible. On the other hand, I am not in agreement with the extent that you're willing to go to do that. We would not approve of you going house to house to house and taking our kids forcibly out of their homes any more than we would allow you to put a mask on their face. Secondly, I would like to say, in the light of wanting to keep our kids in school, our grandkids in school, parents are aware that if they send their kids to school without a mask, under the current guidelines, that they risk a longer quarantine. Risk-benefit analysis is their right. If they're okay with their kid being sent home and being quarantined until this quarantine garbage is figured out too, that should be their right. You should not have the right to forcibly keep their children in school via a mask. That's all I have to say.
Thank you. Sir?
Rob Rockhorse, Medina, Ohio. So it's inevitable that the board is split. I see that. So I want to speak to you directly, Mr. Skidmore. It's not a question and answer. I just want to speak directly to you. So you seem to be the deciding factor here. And I want you to put yourself in our shoes. So my daughter was quarantined today. We got a call saying that she has to quarantine today. So my wife asked specifically, what about my youngest daughter? Does she have to quarantine? And they told her no. So think about the science here just for a minute. If my oldest daughter possibly has COVID, because she's quarantined, right, not to spread COVID, that's the point of quarantining, she gives it to my youngest daughter, who is allowed to go to school, who then infects all these other kids. The science doesn't make sense. Sir, all I'm asking you is, your option 2, you were looking at the numbers. The numbers are skewed. This is all over the place. We're asking you to allow us to make the decision like was at first, and let's see how this plays out. This is our right as parents to let our kids wear masks or not wear masks. Just like with again, look at it from our point of view, Mr. Ross down there. I don't know if anybody else heard this, but he said, we need to get a hold of this so we don't go back online. To me, what that looks like is we're going to go ahead and mask for a little bit, and then we're going to say it's not working, mask for a little bit more, then guess what? We're going back to online. Because that's what's wanted. They want to go back online. We want our kids to stay in school, and we want to have the right to put a mask on them or not. That is our right. So I'm just asking you, sir, to take that into note. Does that make sense to you? My daughter is quarantining, so she won't pass COVID on, but she could give it to my youngest daughter to pass it. Scientifically, that makes no sense. You're an education board. That's the science. I'm done.
Thank you. Over here.
My name's Aaliyah. I live in Wadsworth. I go to Medina Christian Academy. I used to go to Claggett for a good while. While all of COVID was happening, I did online school, but I knew many people who went in person for the little period that there was when it wasn't on and off. But I knew friends who were quarantined just because they sat in the same room with someone who was COVID positive. And this is my cousin here. She was taken out of school for 5 days because she tested and had to be quarantined. I know so many kids who are so far behind because they had to leave school for 2 or 3 weeks because of COVID, who just because they didn't want to wear a mask had to leave school. And I think it's kind of funny how we have to wear masks in math class and science, but then we can go to the football game and sit right up against each other and scream and yell, and it doesn't seem like there's a problem there. It's okay to go to something that provides money for the school and not wear a mask, but math class is so dangerous. It doesn't make a lot of sense to me. Casey? No. Are you all done? You sure?
All set? Okay, thank you. Next.
I already introduced myself, but Christy Dunmeyer from Medina. I wanted to add, if you're gonna put the responsibility on the children to stay in school, maybe the high school, I know for a fact, there's no social distancing at the high school. They're sitting 8 kids to a lunch table. Last year there were 4. Granted, you had, 2,300 kids in school? Probably a little difficult, but there's no social distancing. Their desks are all on top of each other. My son says he opens his Chromebook and the kid in front of him hits it with his head. There's no social distancing. So the school should take up some responsibility of keeping kids safe instead of putting it on the kids to mask. And the whole reason for the mask is if 2 kids are masked, they won't be quarantining anybody. So the numbers will go down. So for 2 weeks, if you mask your children, of course your numbers are gonna go down because you won't be quarantining anybody. You're quarantining healthy kids. My son, same thing. He got tested on day 5, because that's a random day that the health department picks. He got his results back on day 6. He couldn't go back till day 8. And I was told if I sent my kid to school with his negative test, you would turn around and send him home. His teachers were not prepared for online. I give kudos to those teachers, I really do. But 2 of those teachers were prepared to teach him online. The rest of them, he wasn't online. Thankfully, he only had 2 days of quarantine because of the delay in reporting. So he was able to only miss 2 days of school. But you're putting all of this on us parents. Again, make it optional or table it for tonight. People who want to mask their children, go ahead. Go ahead, mask them. Leave everything else up to us. And have the schools take a little bit of responsibility for keeping the buildings clean. Water fountains are turned on. Kids are allowed to use water fountains, but they have to wear a mask every other time. It doesn't make sense. I've been working through COVID for the past 1.5 years. I've dealt with COVID patients. I've dealt with people. The logic is you want to keep the kids in the seats and not have to go online. And that's what the high school is being told. My son came home today and said, Mom, you know what we're talking about? We're talking about we have to wear masks because there's a concern that we'll go online. My son could care less. He'd rather go online anyways. But that's what my kid is being told, that if you don't do this, we're going online. Where is the school's responsibility to keep our kids safe? You want school responsibility, clean it. Use the money that we pay and get your sanitizing. They have sanitizing guns that you can sanitize the schools with. We do it where I work. There's things that the school doesn't want to do because it costs money. But it's okay to put my kid in a mask so he can just stay in school and go to homecoming. But he can go to a football game and sit with 200 other kids screaming their heads off, which again, love them all. Logic doesn't make sense. Table it for tonight and deal with it at the next meeting or whenever, but let us parent our kids.
Okay, thank you. And our last speaker here for this.
Heather O'Neill, Medina, I've spoke before. Final comment would be freedom is non-negotiable, so we're not going to negotiate with you. We are going to start fighting you even harder than we have been. And there are a bunch of lawsuits that are going to be coming your way. And you said you were afraid of being sued for libel if someone would get sick with a virus where they can't even prove where they got it. I don't know how you could sue for that. But you should be very concerned at what you're doing to these children and the precedent that you're setting with them and the thoughts that you're putting in their head. And, you know, we're going to tell our kids to fight for their freedoms. We're not going to let you bully them around, and we're going to fight it. None of this is negotiable. We live in the United States of America, and you have no rights to do these things to our children. All day, every day, absolutely not. We've put up with it way too long, way too long. And, you know, it's non-negotiable. So if you aren't going to vote for an option 3, which is do nothing and leave everything optional to the parents, then you're going to have problems. And these people all attest to that.
Okay, thank you. Okay. Please state your name and address.
Daniel Weimer, 310 Canterbury Lane. I signed up to speak, but been waiting for 3 hours, and I feel, you know, the time is here. So Thomas Jefferson said, all tyranny needs to gain a foothold is for people, excuse me, people of good conscience to remain silent. It's very, very apparent that's not happening. We have all been through a lot over the last 24 months. But the most shocking thing of all, to me, is the ability for people like yourselves to not use common sense. We are willing to give up our rights and we are voluntarily abusing our kids for a virus that has a 99.9% survival rate in ages of 0 to 19. If you go by what the CDC tells you, did you know that they own 20 vaccine patents and sell $4.6 billion a year in vaccines? I would venture to say that none of you on this stage or in this audience were ever masked as a kid. So why are we doing it now? Do we not all of a sudden have an immune system? Good germs are bad for us? There's zero medical proof masks work. They exist for propaganda purposes, fear, and control. Masks on kids can lead to oxygen deprivation and CO2 poisoning. The biggest concern I see is, and has been mentioned many different times, is the psychological damage that is being done. Benjamin Franklin said, it is the first responsibility of every citizen to question authority. You are not only taking this away but you are sending these kids down a path that is 100 times worse than any virus. You are creating an environment where they fear everything, along with messing with their ability to communicate and prosper. Do the right thing, make your mandate optional, or we'll see each other again soon.
Okay, thank you. So at this point, I'd ask Mr. Chambers, our treasurer, to please call roll. And this is the roll call for the vote for option 2.
Mr. Skidmore.
Aye.
Ms. Parkhurst.
Aye.
Mr. Harrison.
Nay.
Ms. Pavlik.
No.
Mr. Ross.
Aye.
Okay, option 2 passes. At this point, we have public participation. We have a list of people that would like to speak, and I don't know how many of you so I guess what we'll do is we'll go down and list the names. So I see Andy Toth. So if Andy Toth wants to speak, I have a Heather O'Neill. If Heather O'Neill wants to be ready. Are they here? Okay. And again, hopefully this is something different than what we just went through, because we've already exhausted the topic, I would hope, tonight on masks and so forth. So, I mean, I would hope that as we do this public comment, let me state this again. Please state, attendees shall register their intention, which I think you've done, in the public portion of the meeting upon their arrival at the meeting. After those that have registered have spoken, if time allows, the board president will ask for public participation from all other attendees. Please state your name, address, and affiliation. Please keep comments to a maximum of 3 minutes. No participant may speak more than once on the same topic unless all others who wish to speak on that topic have been heard. All statements should be directed to the presiding officer. No person may address the board or question board members individually. Please go ahead.
The Oxford University just did a new study. A fully vaccinated individual carries a 251 times the normal viral load of COVID-19 and transmissions. we should quarantine you guys from our kids, okay? We are done with fables, sables. We are absolutely done with you, and we're not gonna stop. We're all gonna get together outside. We're gonna do the same thing Mayfield is doing right now, because you know what? It's not good enough to have you fired. We don't want you going to another district and killing other children.
Sir, could you address your comments to
Okay.
the board, please?
So,
Please, just to the whole board.
I can speak whatever I want, as long as I'm not threatening anybody. Don't tell me I can't speak, please. I already have a little respect for you, but not for others. So, I am telling you right now that what happened to me in my personal tragedy because of you bigots, I am gonna fight tooth and nail to make sure that none of you guys will have the opportunity to ruin another child. You, okay? And I still want something to know what my 11-year-old daughter should do. Do I have the option of doing something online for her because you guys have not gotten back to me? Okay, I have an 11-year-old that has been at home since September 1st. At least answer that, okay? Because she deserves some type of education, and I'll be thrilled to do something online, but you guys cannot answer that email, you or Kristen. And I demand an answer there because my daughter deserves that. And as far as my other two, until we figure out exactly what, don't send them home. Do not send them home, because part of that has caused my daughter to do what she did. And for that reason, I will be your worst nightmare, and I will not stop. I want you stripped of everything. And I thought for the last 18 months what it is that you might be good at. And you know what that is? One thing I came up with. You're a Fonzanoon. That is a man that sits in a bathtub and bites the bubbles as he farts, okay? That is what I think you are the only thing capable of doing. And that is what we're going to strip you down to. On top of that, you're going to go to jail.
Okay,
Anybody that wants
Heather
to go along with
O'Neill.
him will go to jail.
Heather
Roll your
O'Neill.
eyes. Roll your eyes. Because you know what the saying that you tell all our kids? Are you going to jump off a bridge because Tim just jumped off the bridge? Of course you're not going to. You'd be an idiot to do that, right? Well, you're following his protocols, and you're putting all the liability on yourself as well. So roll your eyes all you want. It's probably because you don't have oxygen. Take your mask off.
Okay, Heather O'Neill is the next speaker, if she wants to still speak. I'm sorry? You already spoke. Okay, thanks, Heather. And then we had Chris O'Neill was the next speaker. Is Chris here? Okay, no thank you. All right, I'm sorry. I'm trying to follow along. I have a Deb McClure on Ivy Hill. Is she still here?
She's with me.
She's with you?
Yeah, that's her. She's passing.
Okay, are you going for it?
Yeah.
Okay, there you go.
I'm John McClure from Ivy Hill here in Medina. I've been a Medina resident now for 9 years. You know, I'm 59, but I'm still raising kids. And I have a pair of 8-year-olds to go, so I'm going to be at it for a while. And, you know, my wife and I, we didn't come up from, you know, a lot. You know, we came up out of Cleveland and moved into Parma, went over to Westlake. Then we made it into Medina and thought, man, I'm keeping my kids in good schools, you know, and giving the best for them and doing what I can do. It's what I work for. It's what we all work for, to give our kids what we didn't have. I never thought I would do all that to take my 2 kids out and put them in home school. And that's about where we're at. And it shouldn't be that way. My kids belong in school. They need that socializing. That's how they grow. That's, you know, we don't raise them as parents. Their peers raise them all through school every day. They're the ones who gets all the time with them. We don't. And my kids don't get that. You know, they don't get to go to the fun things with the schools or whatever for a few reasons, not just the masks, a few reasons. But I never thought I'd work that hard all my life to give my kids better than what I've had and then have to homeschool them. That's wrong. But that's where we're at. And that's how I feel, and thanks for hearing me.
Okay, thank you, sir. And I have, we already had Deb then. Are you good, Deb? Okay. And then we have Karen Niger. You're good? Okay. And then I have Jessica Weimer. Okay. Looks like I have a Dan Weimer. Dan? Are they still here? Maybe not. Okay. Melissa Meneses on Sunburst? Melissa? No? Okay, and then I had a Megan Hyde on Norwegian Wood. Megan?
I'm just going to finish up what
Sure.
I was saying. Okay, so the issue with the quarantine process that I have is that I'm my kid, I guess, when he got quarantined last year, we were called right away. He was out for 10 days. I did not choose to test. Now I'm hearing parents aren't getting calls for a week. So to me, it seems like the school's okay with the kids staying in school Monday, Tuesday, Wednesday, Thursday, but Friday, it's really a big problem. They gotta get out and stay home for the rest of their time. It just doesn't seem like it's such a big deal when you find out they're exposed to get them out. I actually have heard from some parents that they're having their kid tested to see if they are COVID positive, because then their kid won't be quarantined for the next 90 days. How sad is that? Like, I don't understand it. So then their kid will get COVID, be home for the 2 weeks, and get to go back for 90 days. And that's okay, and they won't be quarantined again for 90 days. The other day, a parent had their kid had COVID 4 months ago, but because it was past the 90 days, they got quarantined again, okay? She stayed home 10 days, went to go back to school. She got a call 5 minutes after going to school, your kid needs to quarantine again. Why? They've been at school 5 minutes. Oh, they were still on the quarantine list. Like, it's not an easy process, so that's, I think, where people are getting frustrated, that their kids are literally walking in the building 5 minutes and getting quarantined again almost, and it's not being selective. Another one, because they kept their kid out of school because they weren't feeling well, went to go get them tested at the doctor for strep. Urgent care didn't want to test them for strep, wanted to test them for COVID because, well, we've only seen COVID cases, not strep cases. The mom got them to test for both. They were negative for both. Sent the kids to school the next day. The office kept the daughter in the office until mom provided a negative COVID test. For what? She kept them home for her reasons. She wasn't exposed. She kept her home for her reasons, thinking they were sick, okay, of maybe something else. But the school kept that daughter in the office until she provided a negative COVID test. They were held hostage in the office for an hour and a half before they could get a COVID negative test. But the mom just kept her home because she wasn't feeling well. Didn't say there was COVID, but they're keeping them locked in the office and won't let them go to class. That doesn't seem right. I'm sorry to say, but on your parent guardian COVID-19 symptom check, it says students with a fever of 100 or above, or a cluster of symptoms. At some point, could you guys verify how many numbers is a cluster? Because that's pretty vague for me. I would like to know, is it 1, 2, 3? How many should I keep my kid home? Because I keep home for what I want to, but a cluster is kind of vague. On your chart that you guys send out every day of the positive cases and the presumed positives, I definitely would like to know who actually comes back actually positive when they are presumed. I get the positive, but there should be a column for positive, presumed, and actually came back positive after you finally tested them, because it's not good.
Thank you. And I have Ann Manzi. I don't know is Ann still here? I know she. Okay, and she had down masks and quarantines as the topic. Okay, and I have a Betsy Jenny. Betsy, I know you spoke earlier, I think. I don't know if she's okay, if she's not still here. John McClure, he just spoke, right? I think they're gone, okay. And then I have a John and Joanna Barnowski on Sturbridge. Are they still here? Okay. You spoke? Okay. Thank you. All right. And Anita Praisler, if she's still here. Anita? On Medina, citizen. Okay, so we'll keep moving on here. So that page, we're good. Nicole Machor?
My name's Nicole Machor. This is just something I've been thinking about. So my children, I pulled them last year because I did not trust the information that was being given to me. And this is actually more towards the audience. I don't know about you, but I'm very picky on who I trust my children with. And education or not, their safety is more important to me. So I pulled mine. I'm grateful for those who showed boldness tonight, stood up for the kids. I'm really grateful for God's will always being done. And a side note, if anyone, even online that's watching, if you're thinking about homeschooling, September 16th at 6 p.m. at Planted Flag, we'll have a night learning about curriculum, field trips, time management, and socialization activities. And there's another organization that's also putting on a night for homeschooling. It's at September 22nd. It's either 6 or 7 p.m. also. It's at 7291 Stone Road. It's being put on by Ohio Freedom Fighters. So feel free to go to any of those. Okay, thanks.
Okay, thank you. Victoria Druley on Laurel Glens. All right, thank you, you too. And then we have Sue Capura on Aaron. Is she still here? Did I say her name right? She lives at 2868 Aaron, not here? Okay. And then Chris Hastings on Turnberry. Chris? Okay. And then Holly Boy on Craggy Creek. I don't know if she's still here. I think she spoke earlier. That's okay. All right. And then we have a Heather Knapp on Brandywine. Except, wait, she didn't check that box. So, okay. All right. And then that page looks good. Okay. And then Tammy Prietel on Providence. Tammy, still here? Okay. And then we have a Kelly Marin on Box Elder. Kelly? Okay. And then we have a Sean Nelson on Worcester Pike. Sean? Okay. And that's that page. And then we have a John Stolarski on Merrimack Circle. John?
Pretty sure I'm going to be brief. I think they're still here. You know what we do, we fight for everybody's freedoms, and that's what this whole evening's been about. Maybe a small victory, option 2, I don't think so, because again, if you're about freedom, option 3 would have been the way to go. I respect your opinion over there as much as you should respect mine. That's why people fight and have died for us. Maybe even some on that panel up there have had some people that have happened to for our freedoms. Freedom to choose. I'm very proud. I've raised 2 very successful kids. I didn't need you guys to raise my kids. That's our job. I'm not going to send them into a burning fire. I can tell you that, into a burning building. Just like I know what I'm going to do. If there's a dangerous situation, we're going to protect them. This isn't it. No offense, but I see a certain individual jogging every morning. Yeah, I know you're outside. You're not wearing a mask. If I went by you, you're going to throw something on? Probably not. It's your right. It's your choice. I don't care. Where we're losing everything is I don't even care about science anymore. I don't care about politics, any of that stuff, because many people already have their minds made up. Of course you were going to vote for issue 2. You wanted the first one. You wanted the first option. So that was a no-brainer, right? I don't want to stand up here and waste my time, but it's very important because we're really missing what's really going on here. And it's about freedom of choice. You want to wear a mask, wear your mask to school. You don't want to wear a mask, don't wear it. Again, there's some people up here, we've been sitting in here a long time, maybe you're going to say you're distant enough, but there's some on the panel that have masks on, some don't. Who cares? I don't care if you're wearing a mask. It's your right, it's your choice. That's what America's supposed to be. And I'm not seeing that, and it's a shame because, again, I will tell you right now, I don't even want to tell you what I do for a living, but I'm seeing it. People are going freaking crazy. They're committing suicide. They're harming themselves, severe depression. We're seeing it all, okay? I would rather take my chance, send my kid to school without a mask on and know that he's healthy because we taught him nutrition and how to work out and all those other things, and to be smart and to have common sense and to critically think, than to worry about these other things that are happening when he's got that mask on all day long. That's what's going on here, and I would really hope going forward here, I hold no ill will towards anybody. People prayed in here tonight. It was powerful. It was awesome. You showed a lot of courage. There's an anti-mask crowd here, and you got up here and spoke, and guess what? Kudos to you. It's your right. That's what this is about. It's about your rights. You guys should not be raising our kids, okay? I take great pride in that. Aaron, no offense, you have kids too. You want your kid to wear a mask, let him wear a mask. I don't need you telling my kid what to do. And I'm fighting just as hard for these people. My kids are out of this school system. They're done. Doesn't matter, because I'm fighting for the right that we all should have in so-called America. So I guess I did take my 3 minutes here because I'm passionate about this, and we're not going away. This is not going to go away, I can promise you that. We're very organized, and we're going to continue to be, and I would just ask going forward, I'm going to pray for every one of you that we can start exercising our freedom and our rights. Thank you.
Okay, thank you, Mr. Stolarski. That concludes with the list of people that signed up. As presiding officer, I'll let 2 more speak that didn't sign up, if there's 2 more that want to go. Anybody? Yes. Amy? If there's 1 more, please come up to this lectern. If 1 more wants to speak, now's the time.
Amy Smoyer, 1000 Old Farm Trail, Medina. And I've been quiet almost the whole last summer that I've been coming. And I am totally for parental rights to choose what they can do, what the kids can do. But my concern, number 1, my child has a group of 5 friends. Last year, 3 of those 5 kids attempted suicide and were put into the hospital, in an in-hospital situation. How scary is that? And that was because of online school. So I sure as heck hope we do not go back to online school. The other thing is, what if, and I know you guys, I just have this feeling that the Ohio Department of Health's flow chart is what we are following, and we are just following that because why? Is it liability? Is that why we're doing that? Because as many people spoke tonight, it doesn't make logical sense. That's my piece.
Thanks. Amy Dudley?
Amy Dudley, Medina, and I just want to say this was my very first school board meeting, and I'm honored to be here, and I'm thankful for everyone who did show up. I'm thankful for the board. We've got our first one at the high school. We have 2 in college. They went to private school, so this is our first experience with the high school. We have 1 in middle school. Our kids love school. They want to be in school. The teachers are amazing. The buildings are amazing. Our community is awesome. It's time to rise up, to speak life. And our kids will be, Dudley kids will be in school. You know why? To speak life. Life and death are in the power of the tongue. Raise your kids the way they should go. As for me and my house, we will serve the Lord. And we will stand strong, and we will have faith, and we will continue to walk by faith, not by sight. No ill will. We're all doing the best that we can, but we have to bring the joy back. Smile when you're out. Talk to people in the grocery line. Ask people if they need prayer. That's what I'm preaching to my kids. And they're athletes, and they're strong, and they're not afraid. So I speak to everyone here online and in person. Rise up. This is the Jewish New Year. I don't care if you're Jewish or not. I'm not, but we're all grafted in, for crying out loud. This is the year 5782, and it started last night. I challenge you, when you go outside to look at the moon, it's a sliver. We're stepping into new territory. The harvest is ripe. Be the hands and feet and speak life. Joy, peace. And that's what I command right now for this community and this school district. Life. I'll ask for the fire to come down, and we are glory carriers to be conduits and never back down. You're gonna get persecuted. You're gonna make fun of. Stand for what you believe in. We're here for a blip. What held us back in the past will no longer hold us back in the future. Get out of our own way, because we're not in control. Somebody greater is. So I just beg you, it's about our future. Our kids is kids is kids is kids. It's not about us. It's not. It's about the future, our legacy, and they're going to rise up warriors, and they're going to be stronger than we ever could have imagined. And so, Jesus, I thank you for this day. I thank you for the breath in our lungs. I thank you that tomorrow's not guaranteed, but today is. And we're going to bring the joy. And Medina, you are full of joy. In Jesus' mighty name, amen.
Okay, thanks, Amy. And at this point, then, if we don't have a reason for executive session that I know of tonight, okay, I'm going to make a motion that we adjourn.
Second.
Thank you, Mr. Ross. Could you please call roll?
Mr. Skidmore.
Aye.
Mr. Ross.
Aye.
Mr. Harrison.
Aye.
Ms. Pavlik.
Aye.
Ms. Parkers.
Aye.
Thank you.